Good morning, everyone. It's 9:15. We were supposed to start at 9. Currently, we have a quorum of 74. It's not yet a quorum. We have 74 delegates in the room, but we need still 20 more to actually reach the quorum. So if you have any contact of any colleague delegate in your WhatsApp that is not here, please just send him a message to please be here. But in order to start, I would suggest that we start with the presentation of the President of the Standards Commission, and we will, of course, I will mention whether we have quorum or not when we need to start the voting. So with that, I appreciate all delegates that were here on time. I recognize your engagement to the standard setting process, and I would like to hand the floor to Etienne Bonbon, the President of the Terrestrial Animal Health Standards Commission. Etienne, the floor is yours.
Merci. Gracias, Monse.
Thank you. Gracias. Who wants to speak first?
So good morning to you all, and I hope that we would have a very good day. It will be very long, and we will work hard. And it's a pity that we don't have quorum right now, but I really, really hope that the 20 that are missed right now appear in a few minutes. So I'm now having the pleasure to introduce to you our colleague, Dr. Etienne Bonbon, and he is the President of the Terrestrial Animal Health Standards Commission, and now he will present, of course, the proposed standards for adoption by our Assembly. So go ahead, Etienne.
Cette fois-ci, merci beaucoup. Merci, Madame.
Okay, so this time it's my turn. Thank you, Mrs. President, Mrs. General Director, Mrs. Deputy General Director, dear colleagues, dear friends. Thanks to all those who accepted joining this meeting so early to listen to this report I'm about to make on the activities of the Commission for the Code, which is in fact the Commission for Animal Health Standards for Terrestrial Animals. So I'd like someone to move my slides, if possible, for the report I'm going to make. Okay, that's good. So, just like every year, we met on 2 occasions this year. And we're not talking about a calendar year, we're talking about a year between each general session. And we meet once in September. So we met in September 2024, and we met again in February 2025. And what was new is that this is a new commission. We had new members, 2 new members sitting on the commission. Next slide, please. Next slide, please. Next slide, please. There you go. So, we have 2 new members, former members, that's including me, but there is also Gaston Funes, Vice President, and Kiyokazu Murai, also Vice President, and us 3 were present on the former commission, along with Dr. Salah Hamami. But we have 2 new members, John Stratton from Australia and Caroline Dubé from Canada. So you see that there is great geographic diversity, but also gender diversity for the first time, because it is the first time we have a woman sitting on the commission. So you were right electing her last time. Well, not because she's a woman, but because she's a great professional, she's excellent, and she contributes a lot to our commission, just like all the other members, whom I want to thank for their work and whom I want to thank for their full availability for the work of the Commission. And through them, we want to thank their employers, because their employers offer their staff's time to WOAH so that these people can work on these standards. Great, thank you. So they have time available so that they can attend the meetings and so that they can do the work between the meetings, because we prepare for the meetings online before the meeting, and between the meetings we may be invited to participate to the work of ad hoc working groups as observers. So it takes time to do that, and then we also need time to work on our project. So that's very important. So once again, thanks to the different competent authorities that make them available to us, and thanks to them as persons. So since May 2024, we had exchanges and we took part in ad hoc group meetings on emergency management. And by the way, this ad hoc group will meet in June, and after our meeting in September, you should have a chapter on the management of animal health emergencies. Then there is another group called a task force, and that's when we meet with other commissions, like the Scientific Commission. So we have a task force with the Scientific Commission to work on animal hosts for reportable diseases or listed diseases. And we also worked on Chapter 4.4 on zoning and compartmentalization. And then afterwards, we drafted the terms of reference for the ad hoc group. And there again, some members of our commission took part in the ad hoc group after the meeting of this task force. We also took part or attended meetings, more general purpose meetings or regional meetings to which we were invited either to report about our work or to support on certain topics for which our expertise is required. And in that case, we can also contribute, and we try and share the work and the workload. And then, and this has been in existence for a few years now, but since COVID, and since we had to organize online meetings, we organized webinars that are fully operational now. And they're now part of our toolkit. So we have these information webinars organized in November and then in April. And they can be organized in each region, and this is where we can present the work of our commission. And by the way, these webinars or similar webinars are also organized by the other commissions. So that's to tell you that we also have strong cooperation with other specialized commissions working on terrestrial animals. So that's the Scientific Commission for Animal Diseases and the Commission for Biological Standards. So these two commissions are constantly in contact with us. But we also have contacts with the Aquatic Animals Commission for overarching topics for which we need to align before propositions are made about a text. So we met with the Bureau. The Bureau is the President and the Vice President, and the Bureaus met in February and September 2024 in February 2025 and September 2024, as you can see on the slide. And we also met with the Aquatic Animals Commission. This is where we presented our work and tried to align our work program so that we get information in due time and collect the position of all other commissions before we come up with a proposal of a chapter. So at least once a year, we talk to one another, thanks to the support of the Secretariat. And I want to thank them, by the way, because the work of the Secretariat is crazy work. But we do have contacts with the members of specialized commissions on a regular basis. Okay, let me click. Does not work. Too bad. There you go. So, yesterday, the presidents of every working group made a presentation. You had one about white fauna, the other one on antimicrobial resistance, and we have good coordination with these groups. And more specifically, the group on AMR works very hard, and I'm delighted Tomoko received congratulations from the entire assembly, because the work they did is of outstanding quality. And now we have a document which is very well prepared. So now we can really do good work from this. So we continue working with them, and based on the priorities that you've established in the working program, we try and see what we can do and what we can contribute to the AMR group. So this is important, but these are texts that need to be reviewed one after the other, depending on the emergency situations. Then there is also cooperation with the group working on wild fauna, and we now have a secretariat, and the wild fauna group also contributes to draft texts submitted to the Commission for Code to see how the wild fauna is included or not in the specific chapters on diseases, so that we can take the wild fauna as a potential reservoir for diseases, but also as a co-host when we look at the epidemiology of each of these diseases and see how these animals can be victims of sentinels for these diseases. So that's an ongoing work, and it's very interesting. We can rely on the opinion of our colleagues from the wild fauna group, because it allows us to look at things more closely, especially when we talk about surveillance, because we want to see whether surveillance of such and such disease does include the wild fauna or feral animals. And then there is trade for wild fauna. So do we take this into account when we talk about the health conditions for international trade? So that's very important. And this is also a way for us to take into account the various elements that can contribute to a better surveillance of animal diseases. Now, with regards to the comments made by member states, so the best is for you to send your comments as quickly as possible. Very early on, when we are in the process of drafting the standard, we received some comments just before this general session, and trust me, and I guess you can understand that, it's very difficult to change a text just before it's adopted. So you want to send your comments at the very beginning of the work process, meaning between the September session or the February session. So I really wanted to repeat this again. And as a matter of fact, the number of comments has increased. I'm not showing you any statistics this time, but last time we did. And you know that these comments, the number of comments increases, but also the quality of these comments increases, because a comment needs to be substantiated by scientific evidence, by papers and studies, so that we can better understand why this comment needs to be taken into account. And quite fortunately, the quality of these comments has increased a lot. And thanks to the system implemented by the Secretariat, all comments are made available in full transparency in Annex 3 to our report, where you can find all the comments that were sent by the different countries. At the moment, you can't see the name of the country standing next to the comment, but those who wrote the comment know that which comment they wrote. And they can see that next to their own comment, there were other comments from other countries and other regions which may contradict their own comment. And now they can see that there can be various positions on one single item. So the work of the Commission and of the experts is to try and see how we can draft a text that would encompass all the concerns of all the delegates as expressed in their comments. And then we also have a summary to explain why such comment was not taken into account, when a comment was not taken into account. So I'd like to invite all delegates to continue improving the quality of their comments and increasing the number of comments. And once again, please send your comments as early as possible so that we can move forward at a reasonable pace and get to the general session with a text which is almost a consensus already. So as there is just 88 delegates in the room, I still have a bit of time. And we can't start working on standards so long we don't have 93 delegates in the room. So as I have a bit more time, I'd like to say that you don't want to look at the reports from our Commission in isolation. You need to look at them in connection with the reports issued by the Scientific Commission and by the Biological Standard Commission, because we have a dialogue with these, and very often when we come up with a proposal, it's fueled by input from these specialized commissions. But we can't just cut and paste parts of the reports published by our colleagues. So once we've worked with the Scientific Commission, once we've worked with the Lab Commission or the Aquatic Animal Commission, we report and we provide more explanation so that we can end up with a draft text. And by the way, the report from these commissions are available online. Then we need to refer to the work of ad hoc groups and working groups. Once again, these reports are available online in full transparency. And once again, we are not doing a cut and paste of the arguments written by our colleagues in the ad hoc groups. We refer to that, and then it's your responsibility to go and read the report from the ad hoc group, where you can find the justifications that we use to come up with a proposal. So it is important to know that, because otherwise the reports would be absolutely gigantic, and we try and reduce the number of pages in our reports so that we just focus on our own proposal. And another thing, please read our past reports, because sometimes there are comments which are repeated year after year, and it's important we restate the opinions that we had in the previous reports, and it's important to continue monitoring all this. We are fully aware of the fact that this is a long time-consuming work that requires lots of energy and lots of human resources in each country. But this is the price to pay if we want to have standards that are owned by all of us and that are agreed by all of us. So the reasons why we move forward in such and such directions, the reasons for which we decided to work first and foremost on such and such standards, and the reasons for which we decide to go for such a text or refuse or accept some of the proposal of the members, doing all this takes a lot of time. Okay, so this year was kind of light in terms of annexes that we will submit to you for adoption. You've seen that there is A and B. A stands for adoption. And by the way, I still have a bit of time. So texts for adoption are not given for adoption as early as February, but they're offered for adoption as early as September. So in September 2024, we'd already identified those texts that should be adopted in May 2025. And I say that because when we come with a text for adoption in February, people say, hey, hang on, that's too late. No, it's not, because in September, we already told you that those texts would be those that would be offered for adoption in May 2025. So maybe these are the texts you want to focus on if you have time constraints. So we have 10 annexes from Annex 5 to Annex 14, which are offered for adoption. And as we can't start working on the annexes because we don't have the quorum, can we work on the working plan, Mrs. President?
Thank you so much. Well, in fact, it's really a pity that we don't have the quorum in the room. And I really want to thank for the ones that are here since we start. And I will remind you that our meeting was scheduled for 9 o'clock. And it's now more over than 30 minutes since the start of the meeting. And we still don't have 93 delegates here. So we cannot proceed the work as we planned. And this is very important that you please speak with the colleagues from your regions and ask them that the necessary commitment of each one in our general session is really, really necessary. And it's really a pity that we want to follow up our agenda and we are not able to do that. And it's not respectful for those that are here since the beginning. Sorry for saying this, but we have 88 and we need 93. So, okay. Okay, so I guess that the proposal that Dr. Etienne made, it's the one that we can do right now. So yes, please, we will do the work plan. And please try to find the colleagues to become here as fast as possible.
Merci, merci, Madame la Présidente.
Thank you, Mrs. President. I talked about Part A, Part B, and as we can't start with Part B, with Part A, we'll talk about Part B, the one for comments and information. So if somebody could put my presentation back on the screen, and I'll tell you where to stop in the slides.
Quelqu'un peut le faire pour moi, défiler pour arriver jusqu'à...
Maybe you can help me we want to move to part B on comments. It's after Annex 8, I think. Yeah, the control room is going to do that for you. Okay, moving on. Thank you. So, here is the working plan of the Commission. At the moment, we have 65 working items. The working program is a specific annex in our report. It's Annex 4. And after you've read the response to comments in Annex 3, please take a close look at Annex 4. That gives you the list of items or topics which are currently on our desk. And 49 are ongoing. So it means that there are some on which work has not yet started because we don't have all the necessary data, or there are topics that had higher priority, etc. But it doesn't mean that they're not part of our working program. So we have a priority ranking from 1 to 4, and sometimes you can have topics that are priority 1, and we've not started anything because we are waiting to receive scientific data, but it doesn't mean it's not a priority. So priority ranking doesn't mean that this is priority 1 items are going to move faster than the others, because sometimes we can't. And then we sometimes need the chapters in the manual to be revised before we can start doing anything. And you will see that many of these topics are addressed in connection with our colleagues from the other commissions. When we met in February, and we selected texts for adoption. As I said, some have been selected as early as September. Some were not offered to adoption because there were too many comments that came in between September and February, and there were too many changes between September and February. So we thought, okay, we can't offer it for adoption. Like, for instance, the chapter on biosecurity, which is a pillar when we talk about animal disease control. Well, we felt it was a bit early to present it as it stands now. So this text is not one of the texts that will be offered for adoption. But it came back in the 14 other texts which are going to be proposed for comments. So we have 3 new proposals that were accepted for work, and we have 3 new topics that are going to be addressed. And then at the request of our General Director and Deputy General Director, we try not to increase the number of items too much, because otherwise we couldn't work. So we really try and prioritize things, and this is why I'm asking you to comment our work program and tell us which are your priorities so that we can work on your priorities and have a working schedule that makes it possible for us to work properly. Okay, so I told you about the working program. Mrs. President, you have the floor.
Thank you so much. Now I can announce that we are 93 in the room, so we reached the quorum, and maybe it took us 45 minutes to reach it. So if we are doing like this for today and tomorrow. We will be here until Friday. So we can start now to the agenda like we were prepared to, okay? Etienne, go ahead.
Thank you very much, Susanna. Then I will switch to English. So those who want to change their headsets can. Although maybe you can keep your headsets on English because sometimes you may have difficulties in understanding. No, sorry. Attends. Now I go back.
You think it's better to answer, no?
Yes, maybe it's better that I ask that you pass the slides because, so it's the Annex 5. Okay, voilà. So the annexes, you have the list here, but it's okay, we can pass and begin directly with the Annex 5 on the user's guide. So this user's guide in the past, long time ago, it was just a paper, like a forward in the code. It became a standard. That means that at some stage, we proposed to the members to adopt their own user's guide. The user's guide is part of the code. It's not just a standalone document that is useful. It's part of the code. You adopt this user's guide, and it gives very, very precious information about how to understand and how to use, indeed, as it's named, the code. It is true that it is not yet what we would like it to be in terms of guidance. So it's an ongoing work, and the Secretariat worked a lot on it. So this year, we are proposing lots of change in this user guide, mainly to have a harmonized way of naming animals and animal hosts, which was something that was really very often inconsistent in the code, to try to find consistency in the terminology, and also to explain the way the code should be interpreted and used. We have changed the names, but we have added also there is a work that was done by your colleague, by my colleague Kaz, one of the member, the vice president of the Code Commission, and the Secretariat, about, let's say, like a template, a framework of how to build a disease-specific chapter. So from these documents that we are using in the Code Commission and the Secretariat and the other groups, we have extracted some information that we put in this chapter, trying to detail or at least describe a little bit how a disease-specific chapter is structured, with the chapter title, the number, the introductory, and all the thing about safe commodities, about trade, about status, about surveillance, etc. So this also was added in the user's guide, and I completely understand that this user's guide needs more work. However, at least we can begin by this one, and that's why with this new additional guidance we propose now in the user's guide, I propose this revised version, knowing that we are going to continue to work on it to your adoption. Just I want to highlight one point. In the point A4 of this user's guide, there is a very important sentence, and I read it loud now to you so that we understand. The absence of chapters, articles, or recommendations on particular pathogenic agents, surveillance strategies, animal health status, or trade in commodities does not preclude the application of appropriate measures by the veterinary authorities, provided they are based on risk analysis conducted in accordance with the terrestrial code. So it means that we in the Code Commission cannot cover everything in the code, either because there is not enough data to have something that is applicable for 183 countries, or because we don't have material time, because we need some time. So the members have the right to apply their measures as long as they are based on the same principles that are described in the code. Voilà, so I propose this for adoption, Mrs. President.
Thank you so much, Etienne. So I really would like to hear your comments, so the floor is open. Belgium. Go ahead, the delegate from Belgium.
Next slide, please.
Good morning. Thank you, Mr. Chair. I speak on behalf of the 27 member states of the European Union. The EU thanks the Code Commission for taking into account our previous comments and in general supports the adoption of the revised User's Guide. Specific comments have been submitted in writing for the Commission's consideration at its next meeting. We would like to underline the importance of the User's Guide in providing clarity on case definitions and their interpretation. The EU trusts that the Commission will address these comments meaningfully in order to help clarify what constitutes a confirmed case of any listed disease. Similar comments on the same issue have been submitted in writing prior to the general session on individual disease chapters, but will not be raised separately here today in the interest of time. We nonetheless invite the Code Commission to address them at its September meeting. Thank you.
Thank you. You want to comment anything, Etienne? No. 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 Considering the comments of Belgium, it's okay?
Yes, thank you, Belgium and the member states of the European Union. If you look at the user's guide, there is in the description of the chapter that I was telling you, in the point 10 of the part B, some sentence that is trying to explain what is the introductory part of each chapter, dealing with the presentation of the disease, the definition of the disease, the definition of the occurrence of the disease, which sometimes are not the same. And it's all the time very complicated. We agree that we need to elaborate more on this part to better explain how it is built, how this first part of each disease-specific chapter is built and how it should be interpreted. However, I'd like to also tell that all this is guidance. So this is guidance. This is required by the members to be able to use the code. So that's what we try to do, is to give guidance with the scientific element that we have so that the members can fulfill their obligations in terms of notification. We are going also to work, as you saw in the work program, on the chapter 1.1 with our colleagues in the Secretariat. So this topic that has been said by Belgium, we are going to work on it.
Okay. Are there any more comments?
Sorry, Mrs. President.
We have from Congo.
Congo, yes.
Please go ahead. You have the floor. The delegate from Congo.
Thank you, Mrs. Chairman, for giving me the floor. I'm not speaking on behalf of the African continent, but yesterday, during the reception, during the meeting, I spoke with my friend Etienne Bonbon. I told him that in Africa, we had decided to adopt this specific text, but for not personal reasons, but for logistics reasons, we could not allocate all the tasks. But I explained to him that we would forward our comments in writing to the Secretary, so that when you review all the appendix, the African comments will be forwarded in writing. Thank you very much for your attention.
Okay, thank you so much. Any other comments? I would like to ask you if you could deliver your comments after in the Secretariat for reasons of efficiency in our process. Thank you so much. No more comments. I guess we can proceed for the adoption. Are there any objections? No objections. Are there any abstentions? No abstentions, so I can confirm that we approve this first resolution. Thank you. You can continue.
Thank you, Mrs. Chair. So, just to come back to Honoré what you said, if we have the comments in writing, it's okay. We will follow. Of course, we will take them into consideration in September. If we have them a little bit before the general session, if they are important, that may allow sometimes to take them into consideration also for the text. But any written comment will be looked at in September. Next annex is the Annex 7, Annex 7 on the Chapter 7.1, which is nice. It's the new version, a revised version of the Chapter 7.1 Introduction on Recommendations for Animal Welfare. If you remember, we began this work a few years ago now because there was mainly because of the discussion around a new, let's say, way of dealing with the assessment of the welfare of animals. And this new way of dealing was the 5 domains. And you remember the 5 freedoms, and now we have the 5 domains. Beside the jargon, it's about another way of assessing and addressing the way animals are treated and the way they react, etc. So, for the inclusion of this, and also for a better taking into account some semantic issues like animal-based measures, etc. For consistency of terminology, this chapter was amended, and then there were a few other comments that were received by members, and with these few other comments, we made some little changes, but it's not a big change in terms of number of wording, but important to have this inclusion of the 5 domains. Sorry, in the chapter. So, with this, I think I can let you proceed with the comments and adoption.
Thank you so much, Etienne. So, floor is open for comments. Estonia, and then Canada, and then Japan. Okay, starting for Estonia.
Thank you, Mr. Chair. I speak on behalf of the 27 member states of the European Union. The EU would like to thank the Code Commission for their work on this animal welfare chapter and for taking into consideration most of the EU comments shared during the 3 rounds of consultation. In addition, the EU supports the comment made by Canada on behalf of Kuwait on Article 7.1.5.6, asking to include the reference to light after the word of airflow. The EU supports the revision of this chapter and the idea to include the concept of so-called 5 domains in addition to the well-known 5 freedoms and the 3 R's. Thank you.
Thank you so much, Canada.
I speak on behalf of Quads Alliance and wish to thank the Code Commission for its work on the animal welfare section of the Terrestrial Code. We note that this chapter sets the baseline for WOAH's other animal welfare chapters, and as such, it's paramount that the chapter clearly aligns with WOAH's science-based approach. We request the Commission to make a change in Article 7.1.2, paragraph 5, because it contains a statement that is not factually correct. The use of animals for cultural and entertainment purposes can contribute both positively and negatively to the well-being of people. it is important to acknowledge broadly that the use of animals is interconnected with the well-being of people without presupposing that the outcome will make a major contribution, as this is not always the case. The Quads Alliance urges WOAH to replace makes a major contribution with is interconnected, so the section reads, the use of animals in agriculture, education, and research, and for companionship, recreation, work, culture, and entertainment purposes is interconnected with the well-being of people. The suggested change makes the statement factual while recognizing the connection of animal use with the well-being of people. In addition, to further strengthen the recommendations outlined in this chapter, the Quads Alliance requests Articles 7.1.5.6 be modified to include a reference to light after the word airflow in the first sentence. Scientific evidence indicates that light has wide-ranging effects on animal health and welfare. The revised wording would read, for housed animals, air quality, airflow, light, temperature, and humidity should not be detrimental and should support good animal health and welfare. Thank you.
Thank you so much. And now I have a request from Japan.
Thank you, Madam Chair. First, Japan would like to thank the Code Commission for all your efforts. We have no objection, but following the revision of this chapter, we are aware that further updates to other chapters related to animal welfare will be considered. In such case, any revision should be carefully deliberated, taking into account the importance of a stable food supply and incorporating a wide range of perspectives. The Code Commission may face even greater challenges ahead. However, we would like to request your continued dedication to this important work. Japan always remains committed to contributing to the standard setting process. Thank you.
Thank you so much. And now a request from Colombia. Go ahead.
Gracias, señora Presidente.
Thank you, Mrs. Chair. On behalf of the 33 countries of Americas, we are speaking before this honorable assembly to stress the significance of the alignment of international standards that acknowledge the specificity of our region. WOAH should promote a reference framework with flexible assessment tools for continuous improvement without excluding reconversion for research and infrastructures. We're asking the Assembly not to leave equity behind in health governance, animal welfare, and this has to be based on cooperation and mutual understanding. We are respectfully asking you that as part of the health code revision, the most important point should be the scientific, social, and productive and economic realities of every country. You should start a progressive implementation. We're asking you to start a progressive implementation of strategies based on the suitable scientific evidence for every region. With the support of WOAH and solidarity through members, we will be able to devise strategies for health and welfare to promote animal health and the durability of our production systems. On top of this, Mrs. Chair, Colombia would like to thank the Commission for taking into account all the remarks and comments that were sent to you.
Any other comments? I can see no comments. Back to you, Etienne.
Thank you very much. Thank you, colleagues, for your comments. So I have received also by these comments and some comments by writing. So I will go step by step so that the membership here will be able to realize what we propose. First of all, I'd like to thank you for your support on this chapter and on the other chapters on welfare. And I will answer first to Japan and the Americas about that. We are trying to do the draft text in accordance with the scientific and technical and factual elements that we have at hand, always trying to find ways to give good recommendations to the members. But the animal welfare does not differ a lot from the animal health. Some of these recommendations are not, some countries are not able to apply 100% of those recommendations in animal health as well as in animal welfare. It is not because it is in animal welfare that it should be 100% done today or not, you're out of the market. No, it's the same as in animal health. When you look at the chapter on surveillance or you look at the chapter on quality of veterinary services, in fact, quality of veterinary services, I don't know if any of the members of WOAH comply 100% with the chapter on quality of vet services, but we all try to go this direction. It's the same with animal welfare. We all try to get in this direction, and our duty is to give you the best possible recommendations for you to follow. Of course, the socio-economic and the local situations have to be taken into consideration so that there is not a kind of a feeling of submersion by things that are not possible to do anyway. So we will try to see that, and I thank you for your comments, and I think the colleagues of the Code Commission and Secretariat agree with that. In terms of text, I think that there is no big problem to add the light. It's true that I looked at the other chapters. Light is very often part of the element to have a good or bad welfare. So for this Article 715.6, there is a possibility to add the word light after the word airflow. It would read, for housed animals, air quality, airflow, light, temperature and humidity should not be detrimental. So I propose to add this word light to the text here, if you all agree, following the Quad's comment. The other comment was about another point of this chapter, which is a guiding principle. It's a guiding principle, so it's not very technical. And there is a standalone sentence that talks about that the acknowledgement of the fact that, in fact, humans and animals have a common destiny, and that the well-being of humans depend of animals, and not only for food, also for a lot of things. So this is a list of the things for which the people depend on animals. So it's true that we could argue about the word major contribution and these very, very positive things. However, the word interconnected may be a little bit technical and not general. If you would agree, I would propose that we change makes a major contribution by is associated with, because the principle of being associated is maybe a little bit more showing the truth of what is at stake here. It's not only interconnection it's because there is an association. So if you agree, instead of makes a major contribution to, we would read is associated with, and then that would mean the use of animals, etc., is associated with the well-being of people. That would be the proposal that I put on the floor now. There were also a few comments about the, no, it's not the translation. It's about a wording on what is avoiding and what is minimizing. Every time, and we come back to the comment of Japan, we try to use wording that is incentive. So it's true that sometimes the word avoiding can be, oh, I cannot avoid. I can minimize. However, at some stage, in general, we try to avoid, And when we talk about more specific things, then we minimize, and we minimize the risk. We don't minimize the pain, we minimize the risk of having pain. So in these things, I would propose to change in Article 5, point 5, instead of, at the end of the point 5 of Article 5, instead of saying minimize injury, distress, and chronic fear, to say minimize risk of injury, distress, and chronic fear at this place. And I think, yes, I think that's the only place. Yes, and sorry, Mrs. President, I have still a last comment that I would like to take into account. It's English, it's only English. Maybe it will not appear in the French and Spanish, but we need to put it in front of you because when I read it back, I think there was a problem of English. In the point 7 of the same Article 5, there is a difficulty to understand the end of the sentence. I'd like you to trust me, it's just that even though my English is really, it's not me, it's other people in the House that are very much knowledgeable in English. It says, to prevent severe or prolonged hunger and thirst, malnutrition and dehydration. It's true that it's difficult to understand, and we will write, instead of that, prevent malnutrition, dehydration, and severe or prolonged hunger and thirst, which I think is much understandable. So I see that the delegate of UK is nodding, so we all have an agreement. And I won't change, I think, the French, but I need to speak out here because it should be in the resolution for adoption. So I hope I have answered the comments, Mrs. President.
So first of all, thank you for taking note of the comments and the proposals of the colleagues from the Assembly. And now I present the proposed standard for the adoption with the amendments that you want to react, or I can propose. I guess we can go. I propose, yeah, no one is asking for the floor, so I will now present the proposed standard for adoption, and I will start by asking if there are any objections. No objections. Any abstentions? No abstentions, so I confirm the adoption of this standard by consensus. So, good. Go ahead.
Thank you very much. Thank you, colleagues, for your understanding. We do now going to the next annex. Is the Annex 8? Can we have it on the screen? Yes, thank you very much. So this Annex 8 is about the Chapter 8.13. About infection with Cochleoma omnivораx, New World Screwworm, and infestation with Chrysomia beziana, Old World Screwworm. It's an old chapter, and we add a new part on the Article 1 to describe the definition of the disease. It was prompted by crisis. Two crises. There was a crisis of Old World Screwworm in West Africa last year, and there is a crisis ongoing of New World Screwworm in Central America and Mexico, and this is why we were asked to work a little bit in emergency. We worked a lot with our colleagues of the Lab Commission and the Scientific can really know what to notify when they notify, so that there is a better awareness and early detection of these two diseases, which are in one chapter, because we didn't want to change too much the rules. So we changed the title, and we added a new wording about the definition. It has been circulated twice only. It's a very rare disease, a very rare myiasis. We don't have a lot of listed myiasis in the WOAH code, but it is really a plague. And so we really need to have this done. I'll take this opportunity to talk about the case definition. I talked about that when we had the comment of Belgium and the EU on the user's guide. The user's guide described the first article. Here we have this first article. And we have a case definition which is not at all looking like the others. It's just you have observed and identified as such Cochleomia omnivirax or Chrysomia beziana in a sample from an animal host. So there is nothing about testing. Okay? That does not preclude the fact that if a delegate finds lesions that are look clearly like a lesion of screwworm and knows that there are these flies in the region, it can consider it a case, but we cannot in the code put that. So this definition in the code does not preclude a CVO to have local, specific appreciation of what would be his or hers or her definition of notification of a case to WOAH. Okay? This is the responsibility of the delegate. The delegate is at the heart of the decision, but we in the code cannot put that clinical signs plus epidemiological information can be surely a case. That's why we don't put it here. Okay? Just for us to have that in mind when we discuss other chapters. So, with this, I think we can go for comments and adoption.
Thank you. So, floor is open for comments. Senegal? Yes, go ahead. You have the floor.
Congratulations, Mrs. Chair. I want to congratulate the Commission for the Code for the review of this important chapter on meiosis with screwworm and Schizomia bisonia. And in my country, it's Schizomia bisonia that's mostly present. And we also had an emergence in 2024 and 2025. So Senegal would support the adoption of this chapter.
I see Panama, yes, and Poland after. Go ahead, floor for Panama.
Good morning, everyone. Thank you, Mrs. Chair. On behalf of the 33 countries in the Americas region, we agree with Chapter 8.3 for infection with screwworm and infestation with Chrysomia beziana with Old World screwworm, and we congratulate the Commission for their work because that's a very critical topic for our region at the moment. Thank you, Panama. Poland.
Because yesterday I had a long intervention, so today on behalf of 27, I'd like to only congratulate the Commission for its work, and we would like to support adoption of the changes, and we have no specific remarks on it. Thank you.
Thank you, Christophe. Any other comments? So back to you, Etienne, if you want to add something.
Merci à vous.
Bien.
Well, no, except thank you.
Adoption by the Assembly, starting for asking if there are any objections. No objections. Any abstentions? So it's approved by consensus. So back to you, Etienne. Thank you.
Thank you, Susan. I then will move to the Annex 9, if we can show it on the screen. Next slide. And next slide again. Voila. Thank you very much. So again, this is not a modification of an existing chapter, it's a new chapter. That's why it's, for the moment it's 8Y, because it has not yet found its place in the code, and there will be a number given depending on its adoption or not. So it's a follow-up again of the same work that was initiated with the Department of Animal Health Information and the colleagues from the Scientific Commission and the colleagues from the Lab Commission about trying to give guidance for members to notify the listed disease, and especially those listed diseases for which there is no current chapter in the code. So the first item that should be in a chapter in the code, it's the definition of the disease, what it is, why we put it here, and how to notify an occurrence. So we had a discussion with experts. We have circulated this draft definition 4 times already, and we have the same, I have the same comments as the one I have had on the other chapter on squirrel, is that what we give here, point 123 of the occurrence of Nipah virus, are guidance for members to decide how to notify the disease. I would like also to highlight one point. We have, in the general provisions, we begin very often by a first sentence. This first sentence kind of describes what is the disease, but a very, very little summary of what you have in the manual, of course. But to be able for the members to highlight that sometimes you have some animals that are susceptible to the disease but are not considered animal hosts. It's a work that we have also led with the Scientific Commission and the Lab Commission to see how some susceptible animals are considered reservoir, are considered transmission, possible transmission or not, dead end hosts, or are animal hosts. And these animal hosts are those animals in which the disease is notifiable. Okay? That's why in sometimes there is a possibility to find the pathogenic agent in other species, but if they are not animal hosts, it is not notifiable. For example, for a vector-borne disease, if we find the pathogenic agent in a vector, the vector is not an animal host, so it is not the listed disease as defined, and so it's not the same way of sending the information to WOAH by WAHI's notification, compulsory notification, or by information to WOAH. Voilà, thank you very much. For that, we are proposed for adoption.
Okay, floor is open for hear your comments. Any comments? Paraguay, and then Canada.
Thank you, Mrs. President. Good morning, everyone. I am speaking on behalf of the 33 countries of the region of the Americas. Thanks for the work conducted on this chapter 8.y, infection with Nipah virus, and we support the adoption of this chapter, knowing that we need to continue working on the definition of seroconversion. So we'd like the definition of the code to include the possibility to modify this chapter yet again if need be. And we ask that we check that there is a mention of seroconversion in the entire code so that the results are distributed amongst all members so that they can come up with observations. The need to modify this chapter will be taken into account after adoption of something about the seroconversion. Given that this Article 8.3 is important. It's important to define seroconversion once this is adopted in order to determine its relevance for vis-à-vis Chapter 8.y and other chapters in the code where this would be used.
Thank you. I speak on behalf.
Merci. Je parle pour exprimer notre soutien de la part des 33 pays des Amériques au regard du chapitre 8.y sur l'infection au Nipah-virus. Nous savons que l'utilisation du mot séroconversion au chapitre 8.y.3 devra être revue avant que nous adoptions toute définition de ce qu'est une séroconversion. Merci le Canada. Nous avons maintenant la Hongrie.
Micro, please.
Micro, please, for the
Hungary.
Thank you. I speak on behalf of the 27 member states of the European Union. The EU would like to support the interventions made by Paraguay on behalf of Americas and Canada on behalf of the Quads on the case definition proposed for Nipah virus. Given that the definition of seroconversion will be presented for comments and reviewed by the Code Commission in September 2025, the EU invites the Code Commission to revisit the Nipah case definition once the definition of seroconversion will be adopted. The EU in general supports the adoption of this chapter, provided the comments submitted by the EU in writing are addressed. Thank you.
Thank you so much, Dr. Elias. Etienne, any comments from your side?
Okay. No, I understand the concern. It's true that we are going ahead, and sometimes we have discussions with our colleagues, and the discussion on seroconversion is part of this discussion on case definition, and it's part of the discussion we had with the Laboratory Commission, and we have taken the definition that is in the manual and to adapt it, to have it in the code. Nevertheless, we had some experts that told us that the seroconversion specific to this virus would be enough to notify in itself. I completely agree with that we will anyway revise this definition next year, because we should adopt hopefully the definition of seroconversion next year in May 2026, and in view of this we can come back to this definition and see and all the others where we would have seroconversion, because you have not only the Nipah virus where the seroconversion could be a possibility for the delegates to decide that there is a case. So would it be okay just that for you trust the Code Commission that we are going to look at it, we integrate that in our work program, and then if we have it in our work program, we won't miss it. If it is okay with this and you can adopt this definition, it's the same issue also, because seroconversion is not in a lot of other chapters. But for example, it's not in other chapters that if eventually a delegate and specialist think that seroconversion is enough to declare, why not? But we put it in chapter only when we know and when we have expert advice that say, yes, with this you can be sure. Voila. So if it's okay to adopt, I don't know what will be the reactions of the colleagues.
Okay, with this proposal to put it in the work program, I proposed for adoption. So, any objections? No objections. Any abstentions? No abstentions. Approved by consensus. Thank you so much. We can move on.
Thank you very much. Just so the Secretary, you have noted that. Okay, thank you very much. So we can, thank you, Susanna, Mrs. President. We can move on to the next annex. It's Annex 10. At what time is the... À la sunset. Okay, good. So, we have the Annex 10. Annex 10 is chapter 11.5, sorry, on Mycoplasma mycoplasma subspecies mycoides, so contagious bovine pleuropneumonia, CBPP, which is the most easy way to tell the name of this disease. It's an old chapter, but you remember there was a global work that we began a few years ago to try to harmonize, or at least harmonize some parts of those diseases for which the status, official status, is granted by WOAH. So we began with PPR, classic swine fever, FMD last year, and now we have CBPP and African horse sickness. You remember last year we took them out from the adoption because there were still some things to discuss with our colleagues in the SCAD and in the Secretariat. So, and now we are presenting you these two chapters for adoption. So the first one is contagious bovine pleuropneumonia, and I will not detail all the changes that have been done in this chapter, but mainly these changes were to ensure consistency between the other chapters of the code that have a status granted by WOAH. And I think that now this chapter is ready. I would like to highlight only one point. The point is in the status of the country. In the point 4 of Article 1153, on the country or zone free from CBPP, after the discussions we had during the meeting of the Bureau with the SCAD, we proposed to modify a little bit the point 4 so that the measures to prevent the introduction of the disease are based on the standards that we have in the chapter, but not only in this chapter, also in other parts of the code, the general part, for example, for import-export, so, and surveillance. So these measures that are put in place in a country to maintain the status of freedom once it is acquired, these measures, especially at import, can be also based on a risk analysis that would have been done in accordance with the Chapter 2.1, which is the chapter on risk analysis at import. So this is also to make the members understand that it's not only a question of ticking boxes. It's a question of applying measures at borders, measures at import, that actually reflect the risk of the commodity imported, irrespectively of the box that are ticked or the status. So this was important to highlight in this chapter. We put it also in the chapter on African horse sickness, and if it's adopted, we are going to look at it in our next meeting for other chapter of the same type. Voilà.
Thank you. With that considerations, I open the floor for hear your comments. United Kingdom, I can't see. Brazil, China, okay, and the other, sorry, Netherlands. Okay, so starting by United Kingdom.
Thank you, Madam President. The United Kingdom thanks the Commission for their work and efforts to improve Chapter 11.5. However, we are concerned by the mixed signals in recent discussions. Official disease recognition is described as the gold standard, yet proposed changes to the Article 11.5.3 seem to undermine this principle. Whilst we recognise that only 10% of members have achieved official recognition for CBPP, we must not weaken its credibility. Official recognition is a cornerstone of trust and transparency. We do recognise the value of risk assessment in enabling trade, especially with countries of unknown status, but it must complement, not replace, official recognition. Risk-based approaches must be clear, evidence-based and consistently applied. We urge WOAH to pause and consider the wider consequences, including this approach becoming a precedent. Any change to recognition must be transparent, scientifically robust and shaped through meaningful consultation. We strongly support the creation of an expert group or a structured process to ensure coherence across all diseases of official recognition. Thank you.
Thank you so much, Christine. Now moving to Brazil.
Obrigado, Sra. Presidente. Em nome de todos os 33 países de la región de las Américas.
Thank you, Mrs. President. On behalf of the 33 countries of the Americas, we want to thank the Commission for their work in order to improve the code for terrestrial animals, and we support the adoption of this chapter on the infection with Mycoplasma mycoides, subspecies mycoides, and the 33 members of the Americas suggest there should be additional work so that we can better understand the decision and for the recognition of official status as provided by WOAH. So we want to work on the WOAH official status so that it can demonstrate that members comply with WOAH standards, because this would ensure credibility and trust and would facilitate international trade. Changes in the chapters will help countries that are officially recognized as free from the disease can export or import animals and byproducts so long they comply with the chapters on this disease, or so long they have put in place a risk analysis for the imports and exports. Now, for countries that import from countries which have not been officially recognized as free, we don't want them to lose their status in this reconfirmation, and countries from the Americas ask for ANSIA to initiate research on the reason why a country can conduct a risk analysis and facilitate trade instead of looking at the health status or import from countries that are officially recognized as free from the disease. So we need WOAH to take this into account when we assess the status of the country, i.e. the way this information is shared with other members. We also want this research to be completed before we start changing chapters on the official disease-free status of WOAH to ensure transparency. So we need to do that before we conduct horizontal changes in the terrestrial code. Thank you very much, and obrigado.
China.
Okay. China thanks the committee for your feedback on our comments. However, considering that it is one of the key target diseases that the world is committed to eradicating, from the perspective of disease prevention and control, we will put forward the following recommendations. Firstly, some literature indicates that after animals are infected with contagious bovine pleural pneumonia, the pathogen can be detected in tissues such as their embryos during the early stage of the disease. Secondly, the terrestrial manual points out that animals immunized with the T144 strain may be affected by the residual virulence of the attenuated vaccine. The literature also shows that the safety of the T144 and T1SR attenuated live vaccines for contagious bovine pleural pneumonia is controversial. These vaccines may cause infections in immunized animals, and the infected animals may be in a subclinical state or show no symptoms at all. Therefore, the viral-derived or in vitro produced oocytes or embryos of the infected animals without clinical symptoms also carry the risk of harboring the pathogen. Contagious bovine pleuropneumonia is a highly contagious and acute infectious disease. Currently, some countries have successfully eradicated this disease. From the perspective of the disease prevention and control, international trade in viral-derived or in vitro-produced oocytes or embryos of immune animals is not advisable. So, it is recommended to delay the expression of were vaccinated not more than 4 months prior to collection. In this case, the condition laid down in point C above is not required of Article 11.5.12. Thank you.
Thank you so much. Now I request from Netherlands.
Thank you, Mrs. Chair. I speak on behalf of the 27 members of the European Union. The EU, in general, supports the adoption of the revised chapter on contagious bovine pleuropneumonia, provided that the comments submitted prior to the general session in writing are duly considered. We thank the Code Commission for having taken some previous EU comments into account. However, some of these warrant further reflection in the light of the overall purpose of the terrestrial code. In particular, with regard to the Article 11.5.1, it is important that the definition of the occurrence of the infection with Mycoplasma mycoides, subspecies mycoides, includes a reference to suspected cases under points B and C. This is because it is essential that veterinary authorities remain at the center of the decision-making process when a case requires confirmation. The generic structure of case definitions used across the Code's chapters provide the necessary flexibility and reinforces the responsibility of veterinary authority. This approach should be maintained in this chapter as well. Another aspect we also referred to in our earlier comments on this chapter and on the chapter on African horse sickness regarding the streamlining of the annual reconfirmation procedure of official statuses. Thank you.
Thank you so much. Any other comments? I can see no more comments. Back to you, Etienne.
Thank you very much, Mrs. Chair. Thank you, colleagues. I will take these comments one by one not in the order of the comments of the members, rather in the order of the chapter. Regarding, and I will include also some comments that were sent in writing, in the Article 1 about the case definition, we all, again, I will repeat, trying to be not only consistent, but also to follow the expert advice. We are not specialists in CBPP, but we know what we mean by confirmed or suspected case. In this case, the experts told us, and it has been in the chapter always, that it is not enough to be sure that there is a case if it's only linked, if the positive test is only linked with a contact with a suspected case. See, only when it's linked with a confirmed case. I repeat again that the delegate is able to discriminate what is in his country and say, I consider that even though it is only a suspected case, I have enough information to notify a case. It's possible to notify the case. The flexibility that is given to the members is given through their own responsibility to notify. This is the flexibility. In the code, we don't put a generic definition and then you take it as a menu and you choose it. We put the best guidance possible for the members to notify. So if, for example, there is only a link with suspected, maybe there is a link with other things. Maybe there is a need to another test. Maybe there is a need for something else to be sure. Or the members can take on themselves and say, no, we have CVPP, and then we notify. That's the point we always try to make. Not any of these case definitions are similar. Not one. There is a kind of template, but we don't follow the templates all the time. Also the same for the animal host. I'll explain with the user's guide, and maybe it's a work again that we should do in the user's guide to see what are the animal hosts. Even though we say bovines, bovines now is in the user's guide, and there's a list of animals that are included in the term bovines. However, sometimes in the chapters, we have between brackets a list of species that are not exactly the same as in the user's guide, because for this specific disease, only those specific animals, even though they are called bovines in the chapter, are animal hosts. So I would not accept to change these texts now in the session before adoption. It's the same with the embryos. Embryos, the chapter, the article on importation of embryos, and the same with the semen. We are working with some people who are supposed to be good experts, and they advise us on the best way to mitigate risks at importation of some commodities: animals, meat, embryos, semen. According to the data they have and according to the experience, they tell us, okay, this is enough to mitigate the risk, and then when you import with these mitigation measures, you will not risk to import the disease or the pathogenic agent. The comment from China is challenging one of the recommendations we have from the experts about the in vivo or in vitro embryos, about the vaccination. If there is, again, some challenge, technical challenge on that, I would suggest that these comments are set by written, because we are always can continue to modify, and we send it again to the experts saying we have new data giving us some doubts on this. But for the moment, I would not propose to change such important points now during the general session, because maybe some members say, no, I agree with what is written, so we will have problems. So if you don't mind, well, even if you do, but I mean, this text for the moment cannot be changed. Doesn't mean that we are not taking, there is another comment on semen, a comment that was sent also by another member country, but not spoken out, but it's written. And we will also check the semen to see if the change we made are relevant or not, but the change we made for the moment, since there was no comment before, we considered them good. So the comment that has been expressed by China and the comment that has been sent in writing by other members on the semen and embryos and on the testing will need to be looked at again. We'll discuss with the laboratory commission and with some experts, and if there is a need to change, we'll come back, no problem, on this disease, on these little points. That's one thing about the changes. Relative to the article on status. The article on status is now, that's the thing that we have the most harmonized with the other chapters. And we have a sentence at the end about the retention on the list and what it requires, etc. Of course, to maintain the status, the members should continue to demonstrate that the conditions for their status at the beginning is continuing. Okay, so because of that, there is a need to bring to WOAH information and elements so that the WOAH can continue and our colleagues can continue to be sure that the country's status is maintained. So all these elements include some of these elements that were required for the status in the first place. Because of that, we keep that in the chapter. However, we will have some discussion, and I talk about the comment from I think the Netherlands, or from no, the comment from the Netherlands about sorry, about there's not only a case definition, but something about the status. And the comment of UK I will come just after. So on this comment here, I agree. There is always ongoing discussion with our colleagues on the SCAN and our colleagues on the Secretariat about what is needed in terms of data, and that's maybe a little bit beyond the scope of this chapter or of the code to have this discussion about the process of maintenance of status. And again, the same with the comment from the Americas and the comment of UK, which, if you don't mind, I can put together because they're talking about the same. The status is not meant for a country to get the status and then be able to block everything at import. This is not the incentive for getting a status. The status incentive is to allow a country to trade more easier. But you can trade, a country can trade even if it is infected with some very strict and demanding risk mitigation measures. The status, once acquired, allows a member to trade very easily. The incentive is the contrary. The incentive is that this member can be recognized by importing countries, and these importing countries do not impose trade restrictions to these members. I am a little bit surprised to talk about, oh, you should not allow members, importing members, to do a risk assessment to countries that have not a status, when I hear that nearly all the members with a status don't recognize the status given by WOAH and do a risk assessment beyond that was done by WOAH to address the status. The incentive is not to protect its market when we are of a status. The incentive to get the status is to release more trade. And the incentive is that the status given to a country allows this country to trade easier, in an easier way. So, in fact, adding in the conditions to protect the status, that it can be done either by looking at the WOAH status and the WOAH measures, or doing a risk assessment, has nothing, it's not problematic. It's just reminding members that they should do that before importing to protect themselves. But we are not going to restrict the trade only between members with a free status. That's at least the thing that I thought we had an agreement on. So, in fact, here, I urge all the members to go for the status because that's where we want to go, to reduce the spread, reduce the impact, reduce the presence of those important diseases. I urge the members to look at the status of their exporting trading partners and recognize the status that is given, and don't lose time and money in doing more risk analysis to these countries because they have been already assessed as free. And if a country has no status, then do a risk analysis to see how it can import from this country. So for that, I will not change. However, again, all the written comments will be looked at, and we will have a discussion also with our colleague of the SCAD, but it's important that we don't forget what we are here for. I have received also a comment on very little editorial comment of mistakes that were given by members. So I don't know if I need to specify them there, but you will see in the resolution a few little changes of a does become a do, or this kind of, with an S that has been taken, or for consistency, the word at least is added in some of the articles on trade because they were forgotten. So I trust that you will see that in the resolution, and you will be able to look. It doesn't change at all. The meaning is just an issue of editorial. So to recap, I do not propose to do a change except editorial. The comment on the semen and the comment on the embryos are going to be looked at again in September and discussed with the lab commission and experts that I would have identified. And the discussion on the status and how the members can protect their status while not making unjustified barrier to trade will also be discussed during our September meeting, because it goes beyond this unique chapter. And because also we announced in our report that we will propose these little changes in the status articles also to the other chapters that we adopted in the past. Merci.
Thank you, Dr. Bombon. So, considering his comments, especially to highlight the relation between status and trade, I would like to propose this standard for adoption by the Assembly. And the first question is if we have objections. United Kingdom, please. We have an objection from United Kingdom. I ask the Secretariat to take note. And please, go ahead, you have the floor.
I thank the Secretary for his response, but I think our UK comment still stands. Thank you.
Okay. And the question is if there are any abstentions. China. And I confirm the adoption of this standard. Thank you so much.
So I would propose that we break for a break. The next session will begin at 11:30. I would really request for everyone to be here on time. And please remember that we do need the quorum. For those that have made comments, if you can please, we have our Secretariat here. They are really the ones that work very hard. It's Aki, Leo, Sujon, and Joyce. So if you can please provide them your comments, if you have them written, or if you can send them by email, it makes it easier for our note-taking and for the final report. So please, I'll see you all back here at 11:30.
Okay, colleagues, we are 93. Thank you for coming back. We have quorum. We will start. We'll restart. So, Dr. Etienne, you have the floor.
Thank you very much. Welcome back, colleagues. Thank you, Mrs. President. If we go back to the list of annexes for adoption, we are now in the Annex 11, which is about the chapter 11X. Again, it's a new chapter about infection with bovine pestiviruses, what we call bovine viral diarrhea. The same as for Nipah and the same as for others. It's a new chapter of one article about the case definition, well, general provisions, and it is part of the list of diseases that are listed in the WOAH list in chapter 1.3, but have no chapter for the moment. So we begin the work, at least with these articles on definition of disease and definition of animal host and definition of occurrence. So for this chapter, we have had 6 circulations, because there was a lot of discussions on first the animal hosts, and then on the names of the pathogenic agent, and then also on the way to define the occurrence of the disease. And so with all these exchanges and a lot of exchanges with the experts, lots of discussion with our colleagues of the SCAD and our colleague of the Lab Commission mainly, to define what test would be the best to define a case and how this should be put in the chapter. After that, we came to a final proposal that may not be in accordance with all the opinions of the members, as for other situation. Again, I would like to repeat what I said in the beginning of this session. The fact that there is a case definition in the code is to help members and to drive the members in their way of notification. If this is in the list, if a case definition is in this Article 1, it means that there is a case in accordance with the code and for the purposes of notification, for example. If something else has been found, another finding is found by a member which is not there in the definition, but the member country considers this to be a case, there is a possibility for the members to notify. And then it explains, the member explains in the notification why he wishes to notify this disease this way. And so I don't think I saw an example of a country where WOAH said, oh, no, you notify, but it's not the case because it's not in the definition. I don't remember there is a situation like that. The situation we have more often is that something happens in the country and the country does not notify, but it is the same as what is written in the definition, and then WOAH goes back to the country, hey, you forgot notifying that. So what we put here would be a case. If the members don't want to notify what is there, they have to justify why they don't notify. On the other hand, if it's not there and they want to notify something, there is no problem. Okay. Having said that, I don't want to linger too much along to this text. And sorry, no, that's the only. We received some comments in writing in accordance with this issue of not having all the options that are usually in some other case definitions. So with that into the mind, I propose that for adoption, Mrs. President.
Thank you so much, Dr. Bonbon. So I open the floor for comments. Canada, Austria, and then Canada.
Thank you, Mr. Chair. I speak on behalf of the 27 member states of the European Union. The European Union cannot support the currently proposed case definition and calls for its re-evaluation unless seropositive animals are taken back into the case definition as per the EU written comments submitted prior to the general session. The EU would like to signal that a serologically positive animal should not alone define a confirmed case. It must be accompanied by a clinical signs or an epidemiological link to a confirmed or suspected case. The approach proposed by the EU provides the necessary flexibility for competent authorities, which need to be at the center of the decision-making process. We urge the Commission to withdraw this draft chapter from adoption and bring it back to the drawing board to ensure the views of all members are taken on board. Thank you.
Thank you, Austria. Now, Canada.
Thank you.
Micro, please, here in front for Canada.
I speak on behalf of the Quads Alliance to express support for the request from the 27 member states of the European Union that the new Chapter 11.x infection with bovine pestiviruses, bovine viral diarrhea, not be proposed for adoption at this time. We agree that a statement regarding serological positive animals should be included as an option to define a confirmed case, and that the veterinary authority should have the ability to determine whether a positive result meets the case definition of a confirmed case. Therefore, further deliberation is required to account for epidemiological factors or clinical picture. Thank you.
Thank you. Are there any other comments? No more comments? Go back to you, Etienne.
Thank you very much. Thank you for this comment. If you see the report that we have done in February, in September, in February 2024 already, the Code Commission answered this comment that was already put by writing by acknowledging the possibility for members to notify, but not the possibility to put this as a case definition. We looked at this with a lot of experts, and the experts say, no, the only way to be sure that this is a case is either you find the virus or you find a positive antigen or ribonucleic acid test. For example, and they deny, the experts all deny the interest of clinical picture and clinical signs. They even propose that in the point 2, this test, antigen or ribonucleic acid specific test, alone would constitute a case without clinical signs. So normally we add the clinical signs, but that there no, because the clinical signs have nothing, have no added value to notify a case. So we have discussed that at length with experts and with some of our colleagues of other commissions, and we made the decision not to add this option to the case definition. And I don't think that withdrawing this text now to take it back in September would help, because we will have the same answers again and again. We have done that in the past. So the flexibility is not in the definition. The flexibility is the possibility for a member, as I said, to notify when they are sure there is a case, but not in the case definition, because there, if there are positive serologies and clinical signs which are very wide for bovine disease, then I would say, hey, you have notified, you have not notified, you should notify, you must notify, because it is in the definition. There is no flexibility here. So it's important to see that. But so Mr. President, I acknowledge the comment. I can even say that we can discuss again in September this particular point. However, I don't think we can add it now. And so I still propose to see if this first version of this first new chapter can be adopted without this option, and we'll see that after. So that's the only thing I can see now.
Thank you so much for your comments. So considering this, I present this proposed standard for adoption by the Assembly, and first of all, I would like to ask if there are any objections.
Excuse me, Madam President, I would like to inform you that the Middle East Regional Commission also supports the stance expressed by the European Union and the Regional Commission on this chapter.
Well noted, thank you. So we need to, I really would like to ask you to raise your country cards, please, for the Secretariat to count them.
I will name the countries. If you can stand up and so that the Secretariat can take note, I can see here Denmark, Croatia, Spain, Finland, France, Bahrain, Cyprus,
Iceland,
Slovakia, Slovenia, Sweden, Serbia, Iceland, sorry, Ireland, Italy,
Israel.
Sorry, if I have already mentioned you, please take them down. Spain, Estonia, Germany, Saudi Arabia,
Austria,
Belgium. Last one behind Belgium, if you can stand up, I cannot see the name. Bosnia-Herzegovina, Panama, Bulgaria, Kuwait, Hungary, Malta, Latvia, North Macedonia, Liechtenstein, Lithuania, Israel, sorry, Moldova, Luxembourg, Montenegro, behind Netherlands, Uzbekistan, I see Greece, Russia. Can you tell me the last name? I cannot read, sorry. Romania, Norway,
Czech Republic.
Okay, so we already have a blocking minority. It's enough. So it's not accepted.
Okay. So it's not acceptable, this proposal. Work needs to go, stay on board, stay on the agenda, this standard. Back to you, Etienne.
Yes, no, it is not accepted, so it will not be adopted. It's not adopted, it won't be in the code, doesn't mean that it will be in the work program of the Code Commission. We'll have to discuss that now, in September. Do we keep or not in the work program of the Code Commission? It's another story. But we move on. And maybe some other ways than the code is given by the WOAH to guide members about these case definitions. So there may be another way than put it in the code. If members still ask for WOAH to have some guidance to notify this case of this disease, they may ask to the WOAH headquarters how they can get some information so that they are led to, guided to the notification, because it's still a notifiable disease.
Okay, thank you. Let's move on on the agenda for the next standard.
Okay, so in the next chapter is, is the Annex 15, or the Annex 12.
Yes.
Annex 12, Chapter 12. So it's, yes, it's good. Annex 11, that's just Chapter 11 something, and Annex 12 is the Chapter 12.1, infection with African horse sickness virus. Well, I will not repeat again the long discussion that we had with the CBPP at the beginning of the CBPP chapter. This is the other chapter that was together with CBPP on the list of revised chapter for harmonization between commas. And we did the same type of changes that we did in the CBPP, and also some other changes to have a better taking into account better the coelicoides in the protection of the animals and also in the surveillance. So not a lot of changes, but very changes for consistency with other chapters and for correctness, scientific correctness on this chapter. So we now propose that for the comments of the members.
Okay. Floor is open for comments. I have a comment from Ireland, from China. Okay, starting for Ireland and New Zealand. Ireland.
Okay, thank you, Chair. I speak on behalf of the 27 states of the European Union. The EU in general supports the adoption of the revised chapter on African horse sickness, provided that the comments submitted in writing prior to the general session are duly considered. In particular, we refer to the EU earlier comments on this chapter and the contagious bovine pneumonia chapter regarding the streamlining of the reconfirmation procedure for official statuses. Thank you.
Thank you, Ireland. Now, Republic of China.
Okay, thank you. China thanks the Commission for replying on safe commodities from us. However, considering that AHS is currently spreading in limited areas globally, to avoid large-scale diffusion, it is recommended to carefully determine the AHS safe commodities. Firstly, the meat defined by WOAH includes skeletal muscle and internal organs. The literature indicates that the AHS virus can be present in both skeletal muscle and internal organs. The post-slaughter acid reduction treatment of animals can kill the AHS virus in skeletal muscle, but there are no corresponding treatment measures for internal organs. It is recommended to change meat and meat products to skeletal muscle meat and skeletal muscle meat products. Secondly, AHS is a non-contact disease and belongs to an arthropod-borne infectious disease. Fresh horse and donkey hides and skins may carry arthropod vectors. Once arthropod vectors enter the ecosystem, they are difficult to prevent, control, and eradicate. With global warming, the survival period of arthropod vectors has been extended, and they can even overwinter. It is recommended to change hides and skins to treated hides and skins. Thank you.
Thank you so much. Now, New Zealand.
Thank you, Chair. New Zealand thanks the Code Commission on for the work on African horse sickness. However, we recognise the value of risk assessment in enabling trade, especially with countries of unknown status. Risk assessment must complement but not replace official recognition. So as per the previous conversation about CBPP, we remain concerned that changes to 12.1.3 may be undermining that principle. Thank you.
Thank you, New Zealand. Now, UK.
Thank you, Madam President. The United Kingdom thanks the Commission for their work and the efforts to improve this chapter in African horse sickness. However, as similarly stated in our previous intervention in Chapter 11.5, we are concerned by the mixed messages in recent discussions. Official disease recognition is described as the gold standard, yet proposed changes to Article 12.1.3 seem to undermine that principle. We recognise the value of risk assessment in enabling trade, especially with countries of unknown status. But as previously stated, risk assessment must complement, not replace, official recognition. Maintaining the integrity of official recognition is essential. It underpins confidence and transparency in the global system. We ask WOAH to consider stepping back and fully assessing the broader implications. Revisions must be based in science, openly consulted and carefully considered. The UK supports the establishment of a dedicated expert group or structured mechanism to ensure alignment across all diseases with official recognition. Thank you.
Thank you, UK. Any other comments? I can see no more comments. Back to you, Dr. Bombon, to hear from you.
Thank you very much. If you may, Mrs. President, I will try to have, let's say, a little explanation of what we discussed with the Scientific Commission and the headquarters about these changes into Article 3 and Article 2, because I think it's not only the Article 3 you were referring to. In Article 3 is the definition of a country or zone infected with African horse sickness virus. And for the moment, the first draft was a country or zone shall be considered as infected with African horse swine fever, African horse swine virus, African horse sickness. Yes. Well, never know in the future if we have horse swines, but African horse sickness virus, when the requirements for acceptance as a country and zone free from AHS are not fulfilled. It was understood by a lot of members that if you are not free as recognized free by WOAH, you are infected. That means that, not as China said, it would mean that you have African horse sickness in America, because some countries of America, of the Americas, are not free in accordance with WOAH. So they are infected. And so the members who have imported from these infected countries without taking the measures as for infected country at import would also be considered infected because they are not compliant with what is written in Article 2, that you should take the good measures to import. So there is a kind of cascade of infection, virtual, totally virtual infection, administrative infection of countries because of what is written here. What we decided is to say that a country is infected if it does not comply with the conditions that are in the text, which is something a little bit more realistic. A country can meet the condition but not have applied for assessment by WOAH to have its status. Maybe they have no interest. Maybe, I don't know, but it's the members that decide. It's not us. So they decide not to be. However, if at some stage they need to export a horse, then the importer can assess if the risk of importation of this horse is okay. And if the assessment finds that the country there is no virus in the country, then they can use the risk mitigation adapted to what is the risk in front of them, which is there is no virus. So testing animals or quarantining animals from a country which is free in reality but not in an administrative way would be a big loss of money and loss of credibility. In fact, we're talking about the credibility. So that's why we changed this text. And when we talk about maintaining of this status, for a free country, yes, the free country should take everything to protect the status, which is clear, also for credibility. But this, if in front of this country when they import, there is no official status of WOAH, how can they do, except by doing a risk analysis? This is why we did this change, not to downsize the value of the status. On the contrary, is to make the status something real something based on active risk assessment and science. And so in the CBPP and in the African horse sickness. Now, discussing about, and I understand the fact, discussing about what is the status, should we force all the country to have a status? It happened in the, if you remember, Mrs. President, for rinderpest, but there was a global resolution of the whole membership saying we have to eradicate, so it's a commitment. So those who didn't follow this commitment, then they would be kind of punished or something. They will have to go for this freedom. But in my knowledge, there is no global commitment for all countries to eradicate this African horse sickness, especially a disease that, that is in the wildlife and a vector-borne disease. So sorry, Mrs. I just wanted to explain what is so about. I will leave to you and Mrs. and Monse the comment about having a group reflecting on that. It's not part of this, but I cannot change what we have decided, and it's a very long discussion, and we are very happy with our colleagues on that change of the definition and the status. For the comments on the safe commodities, what we asked to the expert is not only the fact that there might be virus in the, if you look at the definition of safe commodity in the chapter 2.2, it's not only if there is the pathogenic agent in the commodity, but also if this virus or pathogenic agent can be transmitted through this commodity. So there may be a virus in such and such commodity, but if the virus cannot be transmitted, then the commodity is considered safe. For example, for dead-end hosts, you will see in the chapter on equine encephalitides that a horse can harbor a virus, but still is a safe commodity because it's a dead-end host. It cannot be transmitted from this horse to another animal. So that's why we consider it safe, even though it may harbor the virus. It's the same for this product here that we have in the Article 1 bis on a safe commodity. Is because it's a purely vector-borne disease. Now, there were some discussion internal to the Code Commission about the potential non-vector-borne transmission of African horse sickness. This discussion is still ongoing and will still go, because that could then imply that some of the commodity that can harbor the virus could be a pathway. But for the moment, all the data that we looked at, we asked for experts, etc., all the papers we looked at were not positive in the fact that there is other ways of transmission than vectorial. The problem of vectors, I noted the comment from China about the problem of vectors. The thing is, it cannot be addressed in the code, because vectors can be moved by a lot of other things than the skin. When the animal is dying, the vectors usually are going out, but you can find vectors in lots of other things, and we know that we have imported vectors in Europe, for example, from many, many continents, not through animals, but through objects, through containers, through, I don't know, earth, cooked earth, things, objects, etc., and that were not at all linked with animals. So it happens. These things about vectors and the problem of protecting the borders with vectors, it's another issue, but I think might be good to look at it, not only for African horse sickness, but for a lot of vector-borne disease. I think the WOAH is trying to be more active on the vector-borne disease, but I don't think it's, for the moment, it can solve by the code. So with this, I think I answered, and for the moment, we don't want to change this chapter. And although we know that this discussion is, we still go on, and we keep this comment for September.
And maybe to respond to the request of the UK, WOAH will consider the request of implementing an expert group to be able to better communicate on our view of the status recognition process, and so that everything is a lot more clear for all the memberships. Thank you.
Okay, thank you, Monse. With this clarification, well, we have a request from the floor. I will be happy to give the floor to South Africa.
Thank you very much, Madam President. maybe we are not saying it from Africa, but considering that a majority of us in Africa do have the disease, and there is still very big trade of horses between Africa and the rest of the world. We want to thank the Code Commission for having looked at the approach that they are proposing to this assembly. And I want to believe that we will support that approach of risk assessments, which are also adding value to the discussions that are going on at the Scientific Commission. And I'm also very glad to hear that we will continue at the Code Commission, Scientific Commission, to discuss the chapter. Thank you.
Thank you so much. No other comments. So with this consideration and this added information, I'm going to put this standard for approval, so I ask if there are any objections. From United Kingdom, well reported, yes. Abstentions? From Popular Republic of China? No more objections, so it's approved. We now move on the agenda. Back to you, Etienne.
Thank you, colleagues, and thank you, Mrs. Chair. Now, the next annex, Annex 13. We are still in the horse disease chapters in the section 12, chapter 12.3, about infection with Trypanosoma equiperdum, or the name Durin. It has been circulated 3 times, but you remember there was a long work on trypanosomiasis and on works on disease with trypanosomia, and we began with the chapter on trisomosomia transmitted by tsetse fly. That was the first chapter, and then last year, I think, or the year before, we adopted the chapter on Trypanosoma evansi, Sura, and now is the last chapter about specific on horses, which is the Durin, so Trypanosoma equiperdum. So this last chapter was again looked at not only in itself, but also for consistency with other chapters, and we proposed a few changes recently for better reading and better consistency, and also because of comments of members changing a little bit some issues, and especially the fact that in this disease, Trypanosoma equiperdum, there is no possibility to define surely an incubation period. Although the incubation is long, we discussed with our colleagues from the Biological Standard Commission, and so we deleted the definition of incubation period. Voilà, Mrs. President. I propose that for adoption.
Thank you. Floor is open for comments. I have Japan, Canada, and United Kingdom. So Japan, please. Floor is yours.
Thank you, Madam Chair. Japan would like to appreciate the great work of Code Commission on the total equine trypanosomiasis chapters. Japan would like to make a second clarification on particular points of chapter 12.3. As you explained, Etienne, the Code Commission decided to exclude the incubation period, which used to be 6 months, because of the lack of scientific rationale. However, Japan notes that that still in Article 12.3.10, still there is an reference to a 6-month period, which is required for the establishments holding the donor mail regarding the importation of the equine semen. So Japan would like to seek a clarification on this, these two different ideas. Thank you.
Thank you. Now Canada.
Thank you. I speak on behalf of the Quads Alliance. We support the adoption of Chapter 12.3 with editorial amendments in Article 12.3.8 to increase the clarity of the recommendations. The current text of Article 12.3.8 is potentially ambiguous. The inclusion in the introductory paragraph of "for purposes other than breeding and rearing" means the requirements could be interpreted to read that horses can be imported temporarily for breeding and rearing, and the requirements do not apply. It is potentially confusing even when read in parallel with point 2. In addition, the text in point 2 already states that the temporary importations cannot be used for breeding, rendering the text in the introduction an unnecessary duplication. We therefore request removal of the text "for the purposes other than breeding and rearing" and the addition of the text "or rearing" in point 2, point A, immediately following the closing bracket. This addition will provide clarity and maintain the requirement that horses imported on a temporary basis should not be used for breeding and rearing. Thank you.
Thank you, Canada. Now UK. No need for comments. Okay. Any other comments? No? You want to clarify anything, Etienne, considering the comments?
Yes, thank you very much. About the comment from Japan, yes, indeed. The 6 months was kept not as a period of residency. We kept the 90 days as a period of residency. We explained that in the report, to be sure that the animal was there in a free country or a free compartment or free zone or free establishment for the last 90 days. But there is no knowledge of what would be a free establishment. For seamen from an infected country, that's the Article 10, countries not free from Durine, there was a need to define that the establishment has known no cases of Durine, but for how long? So 90 days was the period of residency of the animal in this establishment, but the establishment, how long you want this to be free from. So, and we have another chapter on the recovery of free status of a country or zone, which is the Article 5, 12.3.5, recovery of free status. And the period, the waiting period for the recovery of free status is 6 months after the last case was slaughtered or killed. So we took this 6 months here also and applied it to the establishment to be sure that there was no case in the establishment where the animals were sampled, collected for semen. That's why we did this. Maybe we did not explain it better in the report. I looked at the report, and in fact, I want to apologize because it was not explained in the report. We are in the way of improving this Annex 3 with the comments of the members and the response of the members. It's true that sometimes it's a little bit too much summarized. We are going to work with the colleagues of the Secretariat to not lose some material of a justification when we have this. So I hope it answers the question of Japan. And of course, this is an expert's opinion. It's an expert opinion that says for recovery of status, we need to wait 6 months after the last case with all the other methods. So we use the same for establishment. And we impose the surveillance the same surveillance in the establishment as if it was a zone. That's one thing. The other thing is about the temporary importation. We worked on a broad definition of what we mean by temporary importation. It's true that normally a temporary importation does not include rearing or breeding, and we agree. So it is maybe kind of superfluous to say that we are going to add, for purposes other than breeding, to the fact that we already say that normally for temporary is not for breeding. However, the temporary basis is not defined. It's not defined in the current glossary or anywhere else. So we cannot apply the word importing on temporary basis everywhere in all the chapters. So in each chapter we need to highlight that. I would agree that if we say for purposes other than breeding and rearing, then why repeating it in point 2, where we say are not used for breeding, including, such as teasers. For example, teasers is not breeding and rearing, it's something else. It's part of the breeding process, but it's not breeding. So here, Mrs. President, I might agree that we could add the rearing before the breeding in the point 2A and not put it in the chapeau. And we continue to work with our colleagues to see if it's possible to have a kind of, I don't know how to say that, a definition, because we have other chapters where we deal with temporary importation. We use this temporary importation for pleuroplasmosis, if you remember, we adopted for equine arteritis. So we will have to look back at all these chapters to see if its consistency applied the same way of meaning of what is temporary importation. But if you agree, if the other members agree that we, in the Article 12.3.8, in the chapeau paragraph, we delete the words for purposes other than breeding and rearing, and in the point 2 of the same article, at the point 2A, we say are not used for rearing and breeding. We add rearing and, so that it's easier because there is a lot of big parentheses after, so we don't say breeding and rearing, we say rearing and breeding, including, etc. I hope that would be agreeable to, because it's just to be clear. And with this little change, I think we can propose this text for adoption.
Okay. With these amendments, we propose this standard for adoption by the Assembly. So start by asking if there are any objections. No objections. Any abstentions? No abstentions, so it's approved by consensus for our Assembly.
It's well noted, this last change. Okay, thank you. So we continue and we begin to see the end of our list of chapter for adoption. There is still one more annex on horses' diseases, which is the Annex 14, infection with Eastern equine encephalitis virus, Eastern equine encephalomyelitis, and infection with Western equine encephalitis virus, Western equine encephalomyelitis. This chapter was proposed for comments twice. It was drafted with a specific ad hoc group, which was convened with a very big sense of emergency, because it was requested by the members, especially the members of the Americas region, but other members of Asia also have requested more work on the equine encephalitides. So we put on our work program as a priority 1 the work on these diseases. The first to come were these two, Eastern and equine and Western, but still we have another group which will work on Japanese encephalitis, on Venezuelan encephalitis, and eventually on West Nile virus. And all these are part of a big, let's say, a big block of chapters that are looked at by the experts. And that's why we came here with this chapter early, so that we can continue the work on the other chapters that might be a little bit more difficult. Here we have an example of a vector-borne disease for which the species we are concerned with is in fact a dead-end host. So the equine, it's an equine disease. However, you have more than equine as hosts, and especially you may have humans in some cases as hosts. And so we deal with this chapter not to manage the spread risks through the equines, but we want to manage this disease to have the equines be the good alert system. So equines are here as a sentinels for these diseases. And so this disease, in fact, also the host, the natural reservoir are wild birds. But wild birds are not there because we're not addressing wild birds, we are not controlling the disease in wild birds. It is there, and it will remain there for the next, I don't know, centuries. What we want is to have a chapter that gives us the possibility to have an early warning system so that vaccination can be implemented, and also biosecurity for people not to get the disease, not from the horses, but from the birds, because when you know that there is a horse infected, that means that the virus is highly circulating with a high rate in the birds, and then the mosquitoes can also transmit the disease to humans. So for that, we have an original chapter, because we have an Article 1 on the case definition, and Article 2 on safe commodities, and there you have everything is safe, including live animals, because they cannot transmit the disease, and then a bigger article on surveillance, because this is the key point to have surveillance. Voilà, that's why we have this chapter, and I propose this for adoption, Mrs. President.
Thank you so much. I open the floor for comments. Ecuador and United Kingdom.
Gracias, Presidenta. En nombre de los
Thank you, Mrs. Chair. On behalf of the 33 countries of the Americas, we'd like to thank the Code Commission for this priority topic. Still, we cannot support the approval and adoption of this chapter, and we're asking for this chapter to be withdrawn so that there can be additional comments. We recognize that Chapter 12.4 was distributed for a first round the first time in 2024, for approval in 2025, and the comments would be solely of editorial nature, but most of the comments in the first round of revision were mostly revisions on the contents. Some comments were submitted following the February meeting. This could provide more clarification on the text. We'd rather use virus EEE or virus WEE when we talk about transmission, instead of talking about equine east or western equine encephalitis, and changing the word vector-borne disease by mosquito as a vector, following the amendment and the terminology in the chapter. We're asking to recirculate the chapter for a new cycle of comments.
Thank you, Chair. The United Kingdom supports the request for the postponement of the adoption of this chapter. As highlighted by our colleagues in the regions of Americas, this chapter is being proposed for adoption after only one full round of member country review, whereas the standard practice is usually 2 cycles. It's not just about procedure, though. We know that several member countries have indicated they still have substantive edits and comments that they would like the Code Commission to consider, and we think that proceeding with the adoption at this stage would risk overlooking important technical and practical considerations that would benefit from further discussion and refinement. So we respectfully request that the adoption of Chapter 12.4 is deferred. Thank you.
Thank you so much, UK. Are there any other comments? From Colombia, yes, please, you have the floor.
Gracias, Presidente.
Thank you, Mrs. Chair. In the name of the 30 member countries of the Americas, we would like to underline the global impact of a second full cycle for the revision of this chapter. As mentioned in the terrestrial manual, WE and EW, these are viruses that are mostly present in the Americas, and they are likely to trigger serious diseases in humans and animals. Our region wants to make sure that the updated chapter and the possibility to receive comments and the proposed amendments should be reviewed, because this would be an opportunity to shed more light on major features and prevention and control measures for these specific viruses. And it's also important to fully review the language used in this chapter, because it's quite likely that a part of the chapter may be applied horizontally regarding the chapter on the vector-borne diseases, 21 West Nile virus and 1211 Venezuelan equine encephalitis and Japanese encephalitis. These are priority topics for the working group of the Terrestrial Code chapter on Japanese encephalitis, which is currently being commented in Part B.
Any other comments? So I would like to hear from you, Etienne.
Muchas gracias, Ecuador y Colombia, y también a UK.
Thank you very much to the United Kingdom. Thank you very much for these comments.
Oh, sugar. Okay, let me be a little bit selfish here. We have a lot of work. The other group is going to meet again. We have received also your comment by writing. Could we look at these comments, discuss a few minutes here? We have time. Discuss a few minutes. Try to find ways to have a text which is more consensual and not controversial, and adopt it, knowing that we are going to pass the remaining points or questions that could happen in writing to the other group that is working on the others, so that we don't lose this momentum to adopt a text which is it's 1.5 page. 1.5 pages. It's not very complicated. Huh? These comments, we have them now, but we could have had them in September. In September already we said we would propose this for adoption, because the same region had asked us to be quick. So we are going to be quick, but now if we are too quick, it's a little bit difficult. I think that the changes that are required by the region of Americas in this chapter could be handled now. And if I may, Mrs. President, I could go along that and very quietly, and then we will see at the end if with these changes we could reverse the position and have an adoption, knowing that some points will remain to be discussed, and especially on the surveillance of birds and the surveillance of vectors. Because I understand this is also a major point that was not spoken up but was sent in writing, especially by other members of the Americas like Canada. So we have a problem, and I agree, there is a problem in the definition and the description of the disease. The disease is EEE and WEEE. However, when we talk about transmission, we usually talk about the transmission of the infection or the virus. So what would be my proposal is that in the first paragraph of the Article 1, we say Eastern equine encephalomyelitis EE and Western equine encephalomyelitis WEEE are vector-borne disease of importance to public health. Full point, punto here. And then we say Eastern equine encephalitis virus, between brackets EEEV, and Western equine encephalitis virus, between brackets WEEE, are transmitted by mosquitoes. That would answer the first concern of the Americas. They say it's the virus which is transmitted rather than the disease. Then we would say at the second sentence, therefore equids and their products do not present a risk of transmission. However, equids are useful sentinels for the early detection of infection with EEEV or WEEV, infection with the virus, because that's what we detect. So that would be much more accurate and answer to the concerns, the first concerns of the region of Americas.
Maybe wait here a moment.
Yes.
I really would like to hear from America, or from the region of Americas. What do you think of this proposal? Colombia, yes, please, you have the floor.
Gracias. Gracias, señora presidenta.
Thank you, Mrs. Chair. And in the name of the 30 member countries of the Americas, we're asking the Code Commission to withdraw Chapter 12.4 because in some countries in Americas, the surveillance of dead birds and groups of mosquitoes have been used as an early warning system to support the risk indicators for public health and also to promote prevention measures such as equine vaccinations. So specific changes are too complex to be addressed during today's meeting, and they will be submitted to the Commission so that they can be reviewed during the September meeting.
No, I'm sorry, you didn't let me finish, so that's why I... let me try just once more, okay? If we do that, that was the first point, as I told you, and we changed the name. Then there was a comment on mosquitoes, and not only vector, mosquito vector. We agree that instead of vectors, we'll put mosquito vector everywhere because the vectors are mosquitoes, because that's what we said at the beginning. And we put mosquito everywhere in the article on surveillance. Instead of having vector activity, we say mosquito vector activity, mosquito vectors, etc. So that could be another change. Then the last change I wanted to talk about the added sentence that says, although birds are susceptible to, they often do not exhibit clinical signs and have low mortality, therefore surveillance of birds is not worthwhile. This sentence could be deleted from this version and put for further discussion at the next meeting. We will ask the other group not only to work on, because this surveillance of vectors and this surveillance of wild birds is something that is relevant not only for this disease, but also for other equine encephalitides, like, for example, Japanese encephalitis, West Nile virus, and Venezuelan encephalitis. So, again, I try to find a way so that we have a less big burden of work, because all the rest, apparently, there is no big comments. All the rest seems to be, there is no big thing. The only point is the vector, mosquito vector. We don't want you to say that surveillance of vectors and surveillance of wild birds is useless. Maybe it's not useless, as you said. And we want you to be very accurate in the naming of the viruses. Apart from that, I don't see in the comments that we received opposition to what is written here. So we may lose a momentum to say, okay, we adopted, knowing that for some points, especially on surveillance, we might come back to it after the discussion on other chapters by the other group on the surveillance of vectors and surveillance of wild birds. That's the last try.
Thank you, Etienne. So I would like to ask the region of America if you reconsidered your position, considering these headed comments and remarks from Dr. Etienne. No more comments? Colombia,
Presidenta, tendríamos que revisar en las Américas la...
I think that in the Americas, we should review our position. It's about an internal discussion that should be held in Americas.
Okay, so if possible, we could come back. If possible, we could come back to this chapter after lunch, and you will have a moment to reconsider if you want to. And after lunch, you please tell me what is your position, if you want to reconsider it or not. It's okay? And so we will move forward. Yes, and we will come back to this chapter. It's okay for you? Any other comments?
Yeah,
okay, Dr. Etienne.
Thank you very much. It's important because it's true that this is a chapter which is the key one for this region, maybe more than for the others. So we arrive at our last annex for adoption. I forgot to tell you at the beginning of this session that we put the well, there is nothing on the screen, but we have the last annex, which is the Annex 6. It's an annex which was before. It's the Chapter 1.3 on the list of disease, infection, and infestations listed by WOAH. So this Annex 6 on Chapter 1.3, we put it at the end because we were waiting for the discussions before we adopt or not the list of disease, because we may have had some discussions about the name of a disease on a chapter that we approved or not. So this chapter 1.3 has the whole list. So what we propose every year, nearly every year, is a revision article by article if there is a new disease listed, or we change the name, or we delete a disease, it is delisted, etc. So here we propose in the article 131 to delete the equine encephalomyelitis eastern because we have now it as a horse disease in the article 5 with the name, with the western equine encephalitis. We propose to include infection with Nipah virus because it was not include that. Now Nipah virus with a new definition is a disease of multiple species, not only of pigs. So we take it out from the article 138 on disease of Swede, and we put it in article 131 on multiple listed disease. And then we also make the new name of the New World Screwworm and Old World Screwworm. So we delete the old name and we put the new names. We put the new name of Durine because it was listed as Durine. Now it is infection with Trypanosoma equiperdum Durine. And that's it. I think that even if Americas will still want to retain the chapter, not adopt the chapter on EEE and WEE, there is no discussion on the name of the disease. I'm not wrong. If there is no discussion on the name of the disease, then we could adopt this modification to Chapter 1.3 with the current name that we use, infection with Eastern equine encephalitis virus. Then with this we could adopt this revised Chapter 1.3 with the new names and the new categorization of the disease.
Thank you so much. Thanks for the clarification. So I open the floor for comments. No comments? Let's move forward. So I now propose this standard for adoption. Any objections? No objections. Any abstention? No abstention. So we approve it by consensus by the Assembly. Thank you. Let's move. Yeah, you want to? Yes, please.
Yes, thank you. Thank you very much. We have finished with the annexes that are proposed for adoption. I wanted to have a few minutes on just to show the slide on the chapters that have been sent for comments. If you can show on the screen, I don't know which is the number of the slide. So it's the one after, I think. No, go ahead. Down. Next. Next slide. This is the last one? Yes, that's the one. Go down again. Next slide. Next slide. Voila. Just for you to know which are the chapters that we are working on now. The welfare of transport, animals during transport. The other equine encephalitis we talked about. The revision of chapter 4.4 with a new chapter on implementation of zoning. New chapter on emergency management. A revision of chapter 6.8, Tomoko told you. Removal or not chapters on questionnaires. A new work on the revision chapter 1.1 and the comprehensive revision of the chapter 14.1 on CAEV and 14.5 on Medivisna. We have all this on our plate. That's why maybe you understand why I would like to move on those where there is not big issue. Next slide. These annexes, 14 annexes, were sent in our report in March for your comments. These are, again, maybe new chapter for some case definition, but there are very important chapters on welfare at the time of killing, very important chapter on biosecurity, very important chapter on trade. We really expect lots of comments. We had received a lot of comments already, but for the new ones, we expect a lot of comments. And I think that is all, but you need to send us the comments by, we have that on the next slide, yes, by 4 July, so you still have time. But yes, there is more time during February and September than during September and February, but you have time, and we hope that you will send the comments. You will see there the address to send the comments. It's on our report, and you have the guide to do the comments. And we'll try to, again, see all the comments and hopefully answer them maybe in more detail than we did last time. There is another slide after this one. Yes, that's the last one, but if you also want to comment on the work program or on those annex, please, I think you have a few minutes.
For sure, yes, comments from your side, I'm waiting for them. So Hungary, I only see Hungary, so floor is yours.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the European Union. The EU commends the Code Commission for its continued efforts to prioritize its demanding work programme and appreciates the coordination with other specialist commission. We fully support the revised work programme and its prioritisation. We encourage the Code Commission to review Article 10.4.1 of Chapter 10.4 on high pathogenicity avian influenza, particularly points 1, 2, 3, to improve clarity and ensure accurate guidance to members. We support the ongoing review of the official status process and recall the importance of including the resulting procedure within the WOAH standards to ensure transparency and oversight by members. In other words, the EU will oppose any proposal to remove the official status questionnaire chapters from the code. Regarding commodities, the EU suggests that gelatin and collagen be listed as safe commodities in all relevant disease specific chapters. Gelatin and collagen. Finally, the EU welcomes the work to streamline the chapter on disease notification and remains ready to support these efforts. For more detailed comments on the work program, we refer to the written EU comments already submitted to WOAH. Thank you.
Thank you, Hungary. Any other comments? No
so
more?
Just to ask Hungary, everything that you said there is in the written comments? Everything that was said is in the written comments. Okay, thank you.
Any comment from your side, Etienne?
No, thank you very much. We appreciate a lot the comments from the members, either oral or written, on our work program. It helps us a lot to discuss also with the other commissions, and it helps the Secretariat to prepare for the expertise and for the necessary data that we need for our work. So this is paramount in our work that the members do comment on a work program. It can be done anytime, before general session, but also in between reports. So thanks again.
Okay, and I would like to highlight that if you made some interventions, if it's possible, provide them in written to our Secretariat. So, and now I'm happy to give the floor to our Director General.
Yes, thank you very much, Susanna. I wanted just to highlight what Etienne just said, that we are very happy to have a lot of involvement of members in elaborating the program. That's why we decided this year to have a discussion with experts during regional commission. But there are other means also, but it is very important that you really take part of the definition of the program, because these standards are for you. I also want to thank Etienne and all the members of the Commission for their work on the standards. As Etienne said, these standards are in constant evolution and in constant improvement. And what is very important, I think, for all of us, is that these standards are based on science. And so really, again, thank you for the Commission to be really to keep this very important commitment on basing our standards on science. Thank you very much.
Thank you so much. So this, we will start in the afternoon with one chapter, as we already mentioned. So I'm happy to hand over to Montse.
Thank you very much. We're, for the first time, early, so you will have 10 minutes. Before lunch, please, we need to come back at 12:30. 2:30, sorry, 2:30. I need you to please remember to take your headphones and deliver them back. Also, we have Aki, Joyce, Sujon taking notes. So if you made any interventions, even if you don't have them written, if you can still go, if you want them to be very well reflected in the report, it's important for you to take them there. And then for the members of the Americas, the regional representative is there. So if you want to organize for the revaluation of the position. And coming back, we will have Etienne we will put it back for voting. And then we will continue with the report of the Scientific Commission. Thank you so much. Hello, everyone. Thank you for being here on time. We still don't have the whole quorum, but I would suggest that in order not to keep delaying, we start with the report of the Scientific Commission. So I will hand the floor to Susana.
Thank you, Dr. Monserrat. So I now have the pleasure to introduce to you Dr. Cristóbal Zepeda, President of Scientific Commission for Animal Diseases, who will present the Commission's recent work and recent achievements. So the floor is yours. Welcome.
Thank you, Madam President. Thank you, Director General Monse. I'm here to present the report of the Scientific Commission for the period from May 2024 till today. If we could have the slides, please. Very good. So my name is Cristóbal Zepeda. I'm the President of the Scientific Commission for Animal Diseases, and I'm here to present a summary of our activities during the last year. But as always, I encourage you to read the full report of the commissions that are available on the WOAH website. Oops, that's it. What did I do? Thank you. What am I doing wrong here? Yeah. Oh, it's the big green arrow. There. Okay. Apologies for that. This year, we have a new commission that you elected in past May. The membership of our commission is largely the same. However, we have two new members, Naomi Coger from New Zealand, who is our Vice President, and Arjen Stegeman from the Netherlands. I'd like to thank all the Commission members for the work they've done, not only during our regularly scheduled meetings, but also inter-session. We have been very busy with fast-track applications, and also we provide support to a fair number of ad hoc groups where one of the Commission members is always present. And as well, I'd like to, as always, thank the Secretariat for their incredible support in our activities and always helping us find new ways to make our work more efficient and more transparent as well. Okay, so here's a brief summary of our activities during the period 2024 to May 2025. And during my presentation, I'll touch briefly on each of these topics. So we've had 2 Commission meetings, as usual, in September and in February. We provided support to 13 ad hoc groups, and as I mentioned earlier, in each of these ad hoc groups, there's a member of the Scientific Commission that attends. And the role is not to be a full participant of the ad hoc group, but to guide them on what the thinking is, providing the historical rationale of why we are developing X and Y chapter, or why is that ad hoc group there. And sometimes in ad hoc groups, you have people, experts, that are experts in their field, in that particular disease, but do not necessarily know all the processes of WOAH that are internal to WOAH. So that's why we feel that it's important to have a presence of the Scientific Commission. We work very closely, as Etienne mentioned this morning, with the Biological Standards Commission as well as with the Code Commission. In particular, with the Code Commission, every February we have a technical meeting, which is called a bureau meeting, where the president and vice presidents of each commission meet to harmonize their work plans, to understand which commission is doing what and how to move forward in a more efficient way. The Scientific Commission also has responsibility for recommending the granting of status for the official diseases that WOAH recognizes. And in addition, we are working and have been working for the past several years on drafting case definitions, because there are several diseases that either have a code chapter but do not have a case definition, or do not have a code chapter, and yet we are drafting a case definition that is placed on the website while a code chapter is developed. We also work on listing diseases, and I'll present several of the diseases we looked at, which include HPAI in bovines, which includes bovine paratuberculosis that we looked at, SARS-CoV-2, among others. So, as I mentioned, we have provided technical support for a number of ad hoc groups, and some of these includes the ad hoc groups on biosecurity, SCRAPE, the equine encephalitides, BSC risk status, and sheep and goat pox. But also, there's a number of ad hoc groups that look at the dossiers that countries present for granting the status for the official diseases, including BSC, African horse sickness, foot and mouth disease, PPR, classical swine fever, as well as the endorsed control programs that we have for rabies and foot and mouth disease. We also participate, and we have one member of our commission that participates in the working group for wildlife, and we've participated on an ad hoc group on emergency management that Etienne talked about earlier today, and we are working on an ad hoc group on risk management practices at the domestic and wild animal interface. We provided technical input, scientific input into several code chapters. The number is 12 code chapters in all. This is really a bit iffy today. In September, we worked on the code chapters that are listed there. Some of that work in September was concluded. Some of that work continued in our February meeting. But in total, there were 12 code chapters that the Scientific Commission provided input in. Now, this section is dedicated to the global control initiatives that are supported by WOAH and other organizations. Jenny Hutchinson presented yesterday during the presentation on the animal health status in the world, the situation with foot and mouth disease. We continue to see inter-pool movement of different strains and transcontinental movement as well of some of these strains, which is concerning. And notably, earlier this year, we had 2 separate introductions of foot and mouth disease into the European Union. So FMD continues to be a challenge, continues to move and spread worldwide. At the same time, as you will see when I talk about the status recommendations, we are seeing significant progress in South America, where the vast majority of the continent is now free without vaccination. Still with regards to foot and mouth disease, there's a WOAH FAO reference laboratory network that works to monitor the spread of newly emerging lineages of foot and mouth disease virus. And this is important to understand where these viruses are, how they're moving, how they're spreading, and it's important to share samples, information, genetic sequences to improve vaccine matching efforts, to understand the global virus distribution, as well as to improve diagnostic testing. As you know, we are operating under a global strategy for foot and mouth disease control that spans from 2012 to 2027, and there are already plans to renew and reinvigorate these strategies with the lessons learned in the application of the first one. For Peste des Petits Ruminants, PPR, there have been regional meetings to enhance the PPR blueprint to support WOAH standards, as well as to promote the episystem approach. This episystem approach is like pools of domestic ruminants that are affected by FMD, that sometimes these animals in what is called this episystem span across borders. So it is important to understand these movements and how to be targeted on how we attack and prevent Peste des Petits Ruminants. Also, there was the 7th PPR Grand Meeting where they discussed vaccination strategies. DIVA tools are very important if we're going to engage in eradication. Studies in atypical hosts and wildlife, as well as socioeconomic research. And perhaps most importantly of all, the Pan-African PPR eradication program was launched earlier this year, and that is very significant because this is the first time that we are seeing significant sources of funding dedicated to PPR control and eradication. With zoonotic tuberculosis, there was an ad hoc group that developed guidelines for alternative strategies to control TB infection in livestock. These guidelines were published in October of 2024, and they're very interesting because they're trying to move away from the concept of test and slaughter and apply other alternatives that are perhaps more cost beneficial for developing countries. And in addition, there's an ongoing project to identify a replacement for the existing tuberculin standard for diagnosis of bovine tuberculosis in cattle. With rabies, there was a commitment back in 2015 to eradicate the deaths of humans due to dog-mediated rabies. That goal was or is still supposed to occur by 2030. And investing in rabies control is important because it promotes the collaboration well, not only it saves lives, but it promotes the collaboration within the public health sector and the veterinary services, enhancing the concept of One Health. With African swine fever, we continue to see a significant spread of African swine fever. A few years ago, it was detected in the Americas, in the Dominican Republic, where it is now endemic, but it is and has not spread outside of the Dominican Republic and Haiti. But in other parts of the world, African swine fever continues to spread, and we are supporting member countries in identifying their priorities. That includes the evaluation of African swine fever vaccines and post-vaccination monitoring, risk management practices that are very important to avoid the introduction and the spread of African swine fever. And we're working to enhance and strengthen the African swine fever reference laboratory network. In terms of highly pathogenic avian influenza, there's a new or a revised global control strategy for prevention and control of HPAI that was launched last year and has a horizon up until 2033. It was released in February of 2025, and now we're operating under this new or revised strategy. During the 90th General Session back in 1923, we've implemented Resolution 28, and through that we've implemented guidelines for avian influenza surveillance in small-scale poultry systems and in resource-limited settings. This is important because several countries face challenges in conducting appropriate surveillance in these settings where you have small populations that have very low biosecurity, and we need to establish methods that allow us to provide meaningful data for the control and eradication of highly pathogenic avian influenza. We continue to work with OFLU, which is the WOAH FAO network for avian influenza, and we continue to share data with the World Health Organization, which is helpful for pandemic preparedness and matching for poultry vaccines. The tripartite, FAO, WHO, and WOAH, conducts public health assessments of influenza events in animals and people as well. In addition to these global strategies, the Scientific Commission is continuously updated, and we provide feedback on a number of WOAH-related initiatives, including the new Standards Online Navigation tool, which I hope you've all seen, which is working very well, the WAHIS platform that has made tremendous strides and improvement, the observatory, the incident management system, the research network called STAR-IDAS, and many other things, including the science system of WOAH, substandard and falsified veterinary products program, and the publication editorial board. We come now to one of the core components and missions of the Scientific Commission, which is, in addition to providing scientific input into the development of standards, is to provide recommendations for granting status for different diseases for different countries that submit their dossiers for revision by us. This year, I'm pleased to announce that Saudi Arabia, and by the way, so the resolution that recognizes disease freedom that is proposed now has already been adopted electronically, so I can proudly say that Saudi Arabia has been recognized as free from African horse sickness. The United Kingdom has now 2 zones with a negligible BSE risk, 1 zone consisting of England and Wales, and 1 zone consisting of Scotland. Chinese Taipei is recognized as free from classical swine fever, And we come now to foot and mouth disease, where we have several countries in South America that have made tremendous progress in the control and eradication of foot and mouth disease. We have Bolivia, that had a large zone where they still were free but practiced vaccination, and now the entire territory of Bolivia is considered FMD free without vaccination. This is the entire country of Bolivia. Brazil, same situation, where they were phasing gradually vaccination by zones, and now they have 5 zones. They've elected to maintain their zoning, but they're all free without vaccination, which means that the entire territory of Brazil is now recognized as free without vaccination. Argentina, it's hard to see on the map, but Argentina had a zone where vaccination was practiced in the border with Paraguay and parts of Brazil. Now they've merged this zone with the zone where vaccination is practiced. And so Argentina now has 2 zones, the southern part, which is free without vaccination, and the northern part that is free with vaccination. The Republic of Korea has a zone now that is FMD free where vaccination is practiced, and this consists of the island of Jeju in Korea. Russia has now been recognized as free in a zone that consists of 10 different subjects in the border with Kazakhstan, and it's the purple area you can see at the bottom of the screen. We also review dossiers for the endorsement of official control programs, and this year we recommended and you approved the endorsement of the official control program for foot and mouth disease of Mongolia, as well as the dog-mediated rabies program for Tanzania. So please join me in congratulating our countries that achieved a status, especially, well, all of them. It's a great success when you reach the status where you can claim your country free. It never comes easy. It's a multi-year effort. So please join me in congratulating the countries that. Thank you. Every year, we review all the annual reconfirmations that the countries that have disease control, have freedom at the country or zone status, or the endorsed control programs, we need to review those annual reconfirmations every year. A total of 389 reconfirmations were assessed, and that is largely done by the Status Department, which is a commendable task. And of those, SCAD, along with the Status Department, selects a sample of some dossiers that need to be reviewed, either because we have questions, the Status Department has questions, or we also have room for a random selection of countries to come into this number of reconfirmations that the Scientific Commission assesses during its February meeting. Now, it is important. So 2 years ago, we proposed, there were significant changes made to the BSc chapter, and a new BSc annual reconfirmation form was used by members for the first time during 2024, following the adopted changes that were done in 2023. One thing that I'd like to highlight for all the members here is that this graph shows the number of reconfirmations submitted, and only 72% were submitted prior to the deadline, which means that almost 30% of those reconfirmations are coming in late, And since the deadline is late in the year, we are pushing the Status Department against the Christmas holidays, and they have been having to work overtime trying to deal with the late incoming reconfirmations. So I encourage you, please, for the sake of the Status Department, and so that Min doesn't yell at me at the next February meeting, please submit your reconfirmations on time. Okay, we've heard the requests and the demand by several members to streamline the annual reconfirmations. And we have been working on making the process less cumbersome for member countries. We recognize that this is important, but this is also a fine balance between maintaining the credibility of granting status and maintaining the status and the burden that it poses on countries that have several statuses, because there are several countries that are recognized free for all the diseases that WOAH grants a status for, and they have to provide an annual reconfirmation for all the diseases. So we are working on standardizing the process. We sought disease expert opinion to figure out what is really essential in an annual reconfirmation, and maybe just report on an annual basis if there are significant changes to your dossier or to your epidemiological situation in general. And we are expecting to establish an annual reconfirmation SOP and have clear criteria for when the submission of documented evidence is required. So we are, believe me, working hard to make this process easier on you, but at the same time maintaining the credibility of the entire status recognition program. And we are also revising the annual reconfirmation forms to make it easier with drop-down menus and different alternatives that we're thinking about. Okay, there. In relation to that, the Status Department has launched a disease status management platform, which is, you can visit at a kiosk outside, which has been available since 2023, but they've been updating it with new functionalities and guidance material. So this form will be available, or this platform will be available for delegates to submit their annual reconfirmations in an effort to streamline the process and make it easier for all of you. So please visit the exhibition stand that is just out here. Oops. Oh my God. All right. I want to spend a couple of minutes on this topic. And this is a topic that we were discussing earlier today with the chapters on CBPP and African horse sickness. We have a situation where during the annual reconfirmations, we have to assess what kind of trade is a country that has a status doing with other countries. And we are in the situation where currently for many diseases, many of the listed diseases or the official status diseases, WOAH recognizes only two types of countries: free and recognized free by WOAH, and infected. In reality, there are three kinds of countries: with status recognized by WOAH, without status but free, and infected. So what is happening and what we've been facing is the situation in which a country that has a recognized status is trading with a country that is free but does not have a status, and according to the code, the provisions that need to be followed are those for an infected country. And more often than not, the importing country that has the status is applying measures that are ensuring a negligible risk, but that do not necessarily correspond as an infected status. So we are in a situation where we do recognize that that country is probably free from the disease, hasn't gone through the process yet, but then we're in a position that we need to penalize the importing country. And to us, it doesn't make much sense. We still want to incentivize that all countries achieve the status, but for some countries, they haven't taken the time. The dossier, submitting a dossier, is onerous proposition in terms of time, resources, as well as the payment to WOAH. However, what we are proposing is that a country that is in this situation, an importing country that is trading with a country that is most likely free but without status, has to justify their position and their requirements based on a risk assessment, and we are asking that that risk assessment is submitted along with the annual reconfirmation to SCAD for review and assessment of equivalence. There is a chapter on sanitary and phytosanitary measures already in the code that has an extensive section on equivalence that has been there since the WTO issued the SPS agreement. So there's nothing new. What we are trying is to make more explicit the concept that this is something that is feasible. We don't want to penalize unnecessarily countries that are trading with other countries. At the same time, we want to incentivize member countries to reach their status recognized by WOAH. So it's a multi-pronged situation that is delicate, but is already posing problems, and we need to figure out a way to move forward. And part of that way is, one, with the concept of equivalence, and secondly, that both in the chapter CBPP and African horse sickness that passed this morning, the concept of official recognition is not a condition. So if you meet the conditions for freedom, then you can apply to WOAH, of course, but you can also meet them and not apply. And so that's where we are and how we're trying to harmonize the other official diseases with this idea. Another topic that was mentioned this morning is the idea to move the questionnaires for the different diseases out of the code. Right now, they're in the code, but they're not technically disease standards because they only reflect the provisions that are already embedded in the different disease chapters. And by removing them from the code, it will allow greater flexibility to modify them if needed. This doesn't mean that the process will be less transparent. This doesn't mean that members wouldn't have a chance to comment. It just would make the process more agile. But again, the questionnaire only reflects what is already in the specific disease chapters. So there's nothing different, nothing new. We just would like to make, one, the code a little bit more streamlined, and two, enhance the flexibility to modify or adapt these questionnaires as needed. This is the resolution that you approved electronically with the recognition of the different status for the different countries that we went through. And I want to also spend a minute here, and this is in relation to the submissions for status. And as usual, I'd like to highlight the deadline for submission, which is the date in brackets. So for foot and mouth disease is August 8, for African horse sickness, August 22nd, for dog-mediated rabies, August 15, for CBPP, August 29, September 5 for PPR, 19th of September for BSE, and finally September 26th for classical swine fever. So it's really August and September, where all those dossiers need to come in to the WOAH and the Status Department for analysis and then subsequent revision by the Scientific Commission. Okay. Now, in terms of disease control, this thing is really, okay. We assessed the occurrence of highly pathogenic influenza viruses in cattle in the US to see if it was or met the criteria of an emerging disease. We have seen an increasing pandemic threat posed by avian influenza, extending beyond their primary avian hosts into several mammals, including cattle. The current outbreaks in the United States affect hundreds of dairy herds with losses in production, some clinical signs, and we are finding virus in raw milk as well. We are also seeing efficient replication in mammary gland. We are seeing cow-to-cow transmission and confirmed human cases linked to exposure to infected dairy cows, although limited. With this in mind, we assessed this disease against the criteria for an emerging disease and concluded that it does meet the criteria, and therefore it has been listed under the emerging disease category, which entails an obligation to notify. So, as of April 1st of this year, members need to notify the occurrence of HPAI in bovines as an emerging disease. However, this does not mean that the occurrence in other bovines other than Bos taurus or other mammals should not be reported. It should still be reported under the provisions of Article 1.1.5. So it is important that we do not lose the sensitivity of our system, and we are capturing all the occurrences of HPAI in any species. Okay? We assess two diseases as if they met the conditions for emerging disease. I already talked about the infection of highly pathogenic avian influenza in bovines, and we said it is an emerging disease. And at the same time, there was another disease that was listed as an emerging disease, and we tried to see, or we assessed against the listing criteria. So should SARS-CoV-2 be listed as a notifiable disease? And we came to the conclusion that it did not meet the criteria for listing, primarily because no country in the world can claim freedom. We also conducted listing assessments for infection with Nairobi sheep disease. We recommended the disease to be delisted as there hasn't been a single report to WOAHs in over 10 years. And we went through the criteria and we decided or recommended that it should be delisted. Again, SARS-CoV-2 did not meet the listing criteria. And we also looked at Mycobacterium paratuberculosis and recommended that it should remain on the list of notifiable diseases. We have been working, as I mentioned at the beginning of the presentations, on case definitions, and we looked at the definition. Since we decided to retain paratuberculosis on the list, we looked at the case, a proposed case definition for bovine paratuberculosis, as well as a definition for Maedi Visna and caprine arthritis encephalitis. The next lot or tranche of definitions that we will work with are anthrax, Ojeski's disease, and chlamydia abortus. We work in conjunction with the Code Commission and the Biological Standards Commission to discuss topics that are cross-cutting. And Every year, we meet both in person with the Code Commission. Unfortunately, we cannot do the same with the Biological Standards Commission because our meetings do not align properly. But we are always in constant communication to review terrestrial code chapters, of course, to assess which diseases should be contrasted against the listing criteria, to decide which case definitions we should be prioritizing, looking at emerging diseases, and coordinate our different work plans. So we have in our work plan ongoing issues and new work. Ongoing is the revision of the equine encephalitides, which we were discussing earlier today. We are revising Chapter 4.4 on zoning and compartmentalization. We are planning to have a new chapter on the implementation of zoning, an emergency management, and we have the proposal to remove the questionnaires from the code. In addition to that, we are revising Chapter 1.1 of notification of diseases and the chapters on caprine arthritis encephalitis and Maedi Visna. Okay, and with the Biological Standards Commission, we worked closely with them for the definitions on bovine paratuberculosis, small ruminant lentiviruses, HPAI in cattle, as well as Nairobi sheep disease and SARS-CoV-2. You can scan the QR code if you would like to have more details on our future work program. And with that, I thank you very much for your attention.
Thank you so much, Dr. Cristobal, for your comprehensive overview of this important work of the Scientific Commission. And before opening the floor for comments, I would like to make a few remarks. First of all, I'm very, very thankful, grateful for all of you because we improve a lot. It took us in the morning 45 minutes for quorum, and now it was achieved in 10 minutes, so good, thank you. We still have to increase, but okay, very good, it's very good. And the other thing that I want to mention is that the draft resolutions concerning the official animal health status and the endorsement of official control programs that we discussed right now, including the associated list of members and zones, were already voted on electronically early this week, and the results of that vote will be announced, of course, tomorrow morning before the animal health certificate ceremony. So thank you for that. And now I open the floor for any comments, any questions from the delegations. Thank you. Hungary, yes.
Thank you. Thank you, Chair. I speak on behalf of the 27 member states of the European Union. The EU congratulates the Scientific Commission for Animal Diseases for its constant and crucial work. We have three comments on the report. The first one, the EU fully supports WOAH's recent decision to consider the event of cows infected with high pathogenicity avian influenza virus as meeting the code definition of emerging disease. However, the EU notes certain inconsistencies in the current working case definition of HPI in cattle and therefore invites WOAH to urgently revise it in consultation with the specialist commissions in order to avoid confusion. Indeed, the disease name, host scope, and diagnostic criteria should align more clearly with current code and manual standards and the actual epidemiological event. We refer to the letter sent by the EU to WOAH in April this year on this matter for further details. The second point, the EU takes good note of the Commission's assessment that SARS-CoV-2 does not meet the WOAH listing criteria. This is due to the lack of countries with demonstrated freedom in animals and the fact that animals are mostly dead-end hosts, while human-to-human transmission remains the primary driver of transboundary spread. We also acknowledge that SARS-CoV-2 has been removed from WOAH's register of emerging diseases. We welcome that the Scientific Commission noted that members may still voluntarily provide information on SARS-CoV-2 in animals to WOAH as other important animal health information in accordance with the code. Finally, the third point, the EU welcomes the progress made in streamlining procedures for maintaining official status. With reference to the comments we submitted on the Code Commission report, we encourage further simplification of the procedures for member countries' reconfirmation process, while prioritizing flexibility needed to address specificities linked to individual cases. Thank you for considering the EU comments when preparing your work program priorities for the coming years. Thank you.
Thank you.
You want to comment?
Sure. The definition of highly pathogenic avian influenza in bovines was developed along with WOAH experts, the OFLU network. It was validated by the Scientific Commission as well as by the Deputy Director General. However, we take note, and we have received your letter, and we will review those comments in our September meeting. And if need be, if we see challenges in reporting by certain countries, we will, if needed, make adjustments to the definition. Thank you for that. I also take note on your support for the delisting and the removing from the emerging disease roster of SARS-CoV-2. Thank you for that. And as I explained during my presentation, we hear the concerns that countries have in terms of the annual reconfirmations, and we are working diligently with the Status Department to figure out new mechanisms to make this less burdensome, but maintaining the quality of the information. Thank you very much.
Thank you, Dr. Cristobal. Comments from Bangladesh, New Zealand, and Ecuador, starting from Bangladesh.
Thank you, Madam Chair. Special thanks to Mr. Cristobal, very nicely present the current status of the disease situation in the world. So as I am from South Asian region, so in your presentation, I did not go through your paper, that was already published in WOAH, but in your presentation, I did not find anything about the LSD. So in our region, recently we faced a great problem regarding the LSD. So maybe we have to give more focus on LSD. And in another thing, as you mentioned, that there is some works on the, especially for the laboratory facility development for rabies capacity development. So in Bangladesh, especially we are, from the government side, we invest a lot for vaccination of around 2 million street dog. So we are now working on that. And another thing is for eradication of the PPR. We are working on that. Hope we already discussed with Felix. The hope we will be submit the dossier this end of this year, because already we have completed 2 doses of vaccination program, around 60 million doses of PPR vaccine all over the country. So that is all about from my side. Thank you very much.
Thank you so much. Now it was New Zealand.
Thank you very much. New Zealand thanks the Scientific Commission for the work, and particularly Dr. Cepeda for providing clarity on this matter of streamlining and creating transparency around the official statuses. We welcome the focus on simplifying the process while maintaining it as a core part of WOAH's work. Thank you.
Thank you.
Thank you so much. Please help me to remember who requested the floor also. Ecuador, yes. And Brazil, yes, Ecuador.
Muchas gracias, Presidenta. Doctor.
Thank you, Mrs. Chair. Thank you, Dr. Cepeda, for your report. Quite simply, in the countries, the Indian community would like to congratulate Bolivia and Brazil for their status, free status regarding foot and mouth. It's important to recognize it because the region has been striving to eradicate the disease. Brazil.
Obrigado, Presidente. Gracias, Cepeda, por también conducir.
Thank you very much, Mr. Cepeda, for working and on the technical analysis for Bolivia. In South America, we're very happy with our achievement for this year, but we are well aware that more efforts need to be made, and in the name of the 33 countries in Americas, I would like to address issues related to official status, trade and transparency for the 33 member states of Americas. We are asking WOAH to gather a group of experts, a topic-related group, or an observatory to address these following topics, 3 topics in total. First, the strengths that encourage members not to apply for official status? Is it mostly due to monetary strength, or maybe there's less motivation to apply for official status if countries can still trade without having the status recognition? How can we use the risk assessment performed by the importing countries to sustain trade with countries that do not have an official status in order to give more transparency and credibility and streamline procedures and presentations of the official status of the members? And number 3, why don't countries recognize automatically the official status granted by WOAH, but they'd rather make their own assessment before trading? Thank you very much. It's just to have a basis for discussion on the topic of official recognition and the significance of recognition that is granted by WOAH.
Are there any comments? Any more comments? No? So I guess we end this session, and I want to thank you again for the importance of this report, and of course to the delegates for your engagement and for your important contributions. Thank you again, Dr. Cristobal.
Thank you.
And now I would like to invite Dr. Etienne to come to the stage again for us to end the morning session. We still have 1 chapter to discuss, as previously agreed. And I will give you the floor. Thank you.
Thank you very much, Madam Chair. So, in fact, we stopped the meeting and the discussion on this Annex 14 about the chapter 12.4 with the fact that I had proposed to the region of Americas that gave us a lot of comments that we take these comments into account and we modify the text now, and we'll continue to work on the text in September, especially on the points that we have taken out in relations with the work done on other equine encephalitides. And we're waiting if this solution could be acceptable by the regions of America and region of America so that we can adopt and continue the work. So that's the point where we are.
Okay, thank you. Floor is open for comments. United States of America, please.
Thank you very much, Dr. Bonbon and the members of the Commission. We appreciate the Commission's efforts to make those changes and address the concerns from the region of the Americas. It does allow the countries of the region of the Americas to support the adoption of the chapter on EEE and WEE. However, we do want to mention that we do feel like it is important to ensure that we have adequate time to respond to changes in chapters as we move forward. So thank you very much.
Well noted. Well noted. Like maybe we will not be as pressé. I don't know how to say pressé in a hurry next time, and maybe we'll tell the members to wait. But then, yes, we'll continue. Thank you very much for that. Thank you.
Thank you so much. Any other comments? No more comments. So I will now proceed and present the standard for the adoption of the assemblies. Or are there any objections? No objections? Any abstention? So it's approved by consensus, and thank you a lot for your precious efforts. Yes, please. Director Jen, yes.
Oh, thank you. I'm sorry, Susanna, I just wanted to thank Cristóbal Zepeda for the very good presentation and all the Commission for the very, very good and important job, and also answer to Region of Americas for their proposal on having a study on this issue of status and recognition of status. And we need to think how we can do this study. Is it via the observatory or via a specific study? But indeed, it is important questions that are raised. Thank you.
Thank you so much. Now we need to move on the agenda, and I have the pleasure to invite Dr. Alicia Gallardo, President of the Aquatic Animal Health Standards Commission, to the floor to present the standards proposed for adoption. Welcome you on stage. And the floor is yours, of course.
Muy buenas tardes. Para mí es un placer hoy día.
Good afternoon. It is a real pleasure for me to be standing here before you to tell you about the work carried out by the aquatic animal of our organization, because we had a very interesting session with a lot of emotions, by the way, and I took a fish with me, a fish from the Amazon River. It was crafted by a Brazilian artist, and I have this fish brooch that was offered to me by a friend from Saudi Arabia. So we are going to share aquatic animals with you each time we take the floor to give them all the importance they deserve. So, to start with, I'd like to say a few words about the fact that we should never minimize the importance of the work of our Commission on Aquatic Animals. So we have two standards, the code and the manual. And then we'll talk about the reference labs, and then we'll talk about our work program. And for the first time in history, fish farming and aquaculture represents higher volumes than fishing. And we know that thanks to the figures published by FAO based on information reported in 2022, meaning that aquaculture or fish farming is now a key business to provide the world with high quality protein, and that's a challenge for all people working in this industry. We also saw that protein, aquatic protein, well, means the production of fish, and yeah, well, that's the majority of farmed animal, then crustaceans, mollusks, and then there are other species, but there is also algae, which contribute aquatic protein to the population. And this is why we talk about organisms and not just animals. And historically, production has always been high, but this time, for the first time in history, volumes are higher than the volumes captured at sea, and the volume of live animals has increased. So there is a bigger production, and there is more trade as well. So it's extremely interesting to talk about standards, and this is what we'll do in a minute. Furthermore, this production is increasingly linked to technologies, and this production provides a livelihood to many people. Remember, during the pandemic, many people managed to survive thanks to small-scale fish farming or aquaculture in local communities. However, there are many challenges facing aquaculture, and therefore we need and develop standards to ensure safe trade. And that's why we worked all along the year on the code for aquatic animals, and we also worked on the manual for diagnostic tests. And our commission also worked, and that was back in 2021, if I'm not mistaken, and our general director was Monique Eloire back in the day, and she drafted a strategy for aquatic animals that combines very well with the strategy that was presented by our current general director. So we have 4 objectives. First, drafting standards. This is what we did in our commission, but standards are not enough, and we need and develop experience and expertise because there are many changes in epidemiology for aquatic animals. 3, we need to face climate change and show resilience. How can we face this in an industry that depends on water? Water that is very important, whether in open or closed systems. And last but not least, leadership. How do we work and address the importance of aquaculture within WOAH? So, to achieve all these objectives, we look at various things, and our former strategy comes to an end by the end of 2025. So, Mrs. Director, we are perfectly aligned to continue along what you said about the strategy of the entire organization. And this is why we are now moving towards new standards for risk management. And this morning, when the president for the Commission of Terrestrial Animals talked about risk mitigation based on standards, I really like that. And today we are going to offer standards based on that.
To say in the room, we are almost, we have only 1 delegate more than quorum, so you cannot leave the room, okay? Or we will stay here. I will close the doors. Thank you so much, and sorry for this. Sorry. Go ahead.
Gracias, Presidente.
Thank you. So, I was saying, we reviewed some of our standards, we updated them, but we also addressed the question of animal welfare that you talked about in the terrestrial code. And we asked a consultant to analyze the current standards that we have and the current guidelines at global level that exist for aquatic animals, because our code already has standards for the transportation and the slaughter of aquatic animals. So we need to look at all this in September when we meet in order to make a decision and come up with a proposal for our next general session. And then we want to thank the observatory for the work they did. We've seen the main problems or challenges raised by the implementation of these standards. The number one challenge has to do with training. Training about the content of the manual, content of the code. And another challenge is linked to leadership issues. And these are topics we'd like to address with the regional commissions. Today, I'm standing before you representing the commission that you can see on the screen with all the members you can see. So we have Dr. Saraya and the other participants. Dear friends, I hope that you're online with us, and I want to thank you because your work was very interesting. We all come from different parts of the world, which makes our work ever so interesting. We carried out many activities since our last general session. We met twice a year. We have a meeting in February and a meeting in September. We also have online meetings to address various topics, and we took an active role working with the ad hoc groups. And I'd like to thank countries that contributed expertise. We have a chapter in the Aquatic Code and chapter 1.5, which is criteria to include susceptible species in each chapter. And for this, we worked with the susceptibility group for mollusks, but also for fish. And we also worked with the ad hoc group on emergency management. The support from science is crucial for us. And everything arising from the code or included in the code is supported by science provided by experts from various countries. We also took part in meetings in different regions. We took part in webinars, and we coordinated with the Commission on Biological Standards and with the Commission for the Code on Terrestrial Animals. We also coordinated our work with the AMR group, and I want to thank them for their cooperation. Now let me tell you about the text that we submit to your vote for adoption. Fear not, there are many texts. I know it's late, but I'll try and go through these texts quickly while giving you all the details, because we need you to understand all the changes. So we decided to work on section 4, which is the chapter on disease control and prevention. So we had a global conference in Chile in 2024, and those countries that took part said it was important to be prepared for emerging diseases. And that's perfectly aligned with the strategic objectives we have when we talk about resilience. So I'd like to explain that we have chapter 4.x, so it's in section 4, but we don't yet know what the number will be. But it's called Preparedness for Emergency Situations. And that's a chapter on which we worked, taking into account the recommendations that FAO implements in order to manage emergency situations and in order to talk to competent authorities using the same language so that there is no confusion. And that was the first thing that we promised we would do, and we did it. Second, we wanted to include the diseases on the list, of course, but very often emergency situations are with diseases which are not on the list. So we've included emerging diseases which are not on the list and diseases which are quite significant in the country. That's why we talk about relevant diseases. And this is something we do in every chapter. And that's important because it encourages competent authorities to address the totality of the risks when we talk about diseases in aquatic animals without forgetting about residual risk. And we need to take into account the specificities of certain diseases that affect aquatic animals only. So this chapter includes all the information that's required for a competent authority to be in a position to prepare and implement measures when faced with a situation of emergency. Then there is a second chapter that has to do with management, i.e. the deployment of emergency plans, and that's the second chapter we want to talk about. This chapter was discussed and debated by the countries. There were many comments that came in linked to how we define a case, like for terrestrial animals, but in the specific case of aquatic animals, the definition of a case is included in the diagnosis manual. So we just clarified things and we redefined the case in an emergency situation. We also received comments on the role of the competent authority and their relationship with the different stakeholders, including private industry, which would be impacted by these diseases. We want to, so this is the first chapter that we want to submit to vote and adoption. Okay, so we have a quorum. So I want to know if we continue or if we stop. No, we stop? Okay.
Ask if there are any comments, any observations. Denmark, please.
Thank you, Madam Chair. I speak on behalf of the 27 member states of the European Union. The EU cannot support the adoption of this revised Chapter 4X unless the notion of compensation in draft Articles 4X5 and 4X11 is removed from both draft articles. Moreover, this notion was added after the February 2025 Aquatic Animals Commission meeting without providing an explanation in the report of its February 2025 meeting. As regards draft Article 4X5 on legal provisions and funding, it should be noted that the access of the competent authority to compensation funds is not a prerequisite for an emergency disease preparedness framework. Insurance or industry funds are alternatives to compensations paid by the government. As regards draft Article 4X11 on recovery plan, we would like to highlight that availability of compensation is only a small part of the socio-economic impact of a recovery option. A complete cost-benefit analysis could aid the competent authority in deciding which recovery plan to choose. It's not correct to give the focus of socio-economic impact to availability of compensation, which is, we think, is what is done by adding this notion to the article. Thank you.
Thank you. There are more comments from the Assembly? India, please.
Thank you, Chair. Effective emergency preparedness is absolutely crucial for minimizing the impact of disease outbreak on the aquaculture industry and aquatic biodiversity. This chapter is vital to address the specific challenges faced by the tropical aquaculture, such as the rapid spread of pathogens in especially warm waters and the profound impact of extreme weather events. India strongly supports this new chapter. Thank you, Chair.
Thank you so much. Any other comments? Korea, yes, please, go ahead. The floor is yours.
On behalf of the Asia Pacific region, Republic of Korea supports this adoption of Chapter 4.x by the WOAH, and we anticipate that the simulation exercises based on the realistic scenario presented in the chapter will be instrumental in enhancing the preparedness and response system of member countries to disease outbreak. Thank you.
Thank you so much, Korea. Are there any more comments? I'm sorry, but I really need to confirm if we have quorum. It's okay? Okay. Strict. So I will ask you to, I present the standard for adoption and ask you if there are... Sorry. I was worried with this quorum question. Thank you. Go ahead, Dr. Alicia.
Muchas gracias, Presidenta. Muchas gracias por los comentarios.
Thank you, Mrs. Chair, and thanks for the comments made by Korea. I think that's a very good proposal so that we can work on emergencies in a coordinated fashion. I believe that this is a first step, and this chapter will allow us to move in that direction. Thanks to India for their comments, but with regards to the comments made by Denmark on behalf of the EU, we reviewed the chapter, and indeed, you're right, compensation are part of a small item in case of an emergency, because the chapter talks about vigilance, detection of cases, early diagnosis. Article 4x4 provides for general principles and we believe that the risk analyses and definition of cases for diseases that need to be controlled need to be taken into account, likewise for the emergency plan and simulation exercises. Therefore, based on your comments, as compensation is a smaller item in the program for the management of an emergency, and as funds are required, in Chapter 4x5, we included a requirement, and we said that in emergency programs need funds and resources. So that's included there. So my proposal is that in 4.5, item 2, we could remove and compensation and just say that access to resources, including funds, needs to be sufficient as to allow the execution of the preparedness exercise in case of emergency. And that includes various operational items as listed in Chapter 4.5y, and that means that we would eliminate details about compensation because that's already in the other part of the document. And therefore, in Chapter on recovery, 4.x.11, under item 4, I would suggest to include a clarification when we talk about compensation, and we could remove the paragraph on the availability of compensation and write it in such a way that it explains that we could consider the potential availability of a relevant support such as compensation. Because compensation is important, but this is not necessarily the most important point in this chapter. So this would be a way to talk about legal support, budget support, and then talk about recovery and compensation as being a smaller item in the preparedness system in a situation of emergency. So, now that's my proposal. I'd like to know what you think.
And start by asking if there are any objections. No objections. Any abstentions? No abstentions. So it's confirmed and approved by consensus, this first standard. Thank you so much. You can move on.
Muchas gracias, Presidenta. Pasamos entonces al siguiente capítulo, que es el capítulo relacionado con la operativización de este programa de manejo de emergencias, que es un programa global, un capítulo global, al capítulo 4Y, porque igual no sabemos en qué lugar va a establecerse, sobre manejo de brotes, manejo de brotes de enfermedades. Es un capítulo en que, es como, para decirlo en claro, en que se activan, es un capítulo operacional, de acción. El capítulo anterior es un capítulo de framework, de tener preparado en un sobre cuando ocurra el plan de emergencia.
Je crois que nous avons un problème de... Pardon? Pas d'anglais. Ok. Est-ce que ça marche maintenant?
Can you hear me?
Yeah.
Thank you very much. Thank you. So as I said, it's a chapter for action, how to activate emergency plans. So that's a very operational chapter, very operational. And it details when relevant disease is confirmed, and this disease was previously described in the previous chapter, 4.1 chapter. Mrs. Chair, I am submitting this chapter for your approval.
I can't. Nobody is requesting the floor, so present the standard for your adoption. I start by asking if there are any objections. No objections. Any abstentions? So we can confirm that this standard is adopted by consensus. Thank you so much.
Okay, I propose to go for a break now. We will re-adjourn at 4:30. Please, it was European Commission, Denmark, to provide the comments to our secretariat. We have Patricia, Paolo, Sara, and Mariana as our secretariat for this session. Thank you so much. And we'll meet again here at 4:30, please, on time, so we can have the quorum. Thank you so much.
Okay. I leave you. I come back.
Okay, dear colleagues, welcome back. We need to start again our working session, and so I'll be happy to give the floor to Dr. Alicia Gallardo to continue her presentation about the remaining standards for the aquatic codes. Go ahead, the floor is yours, Dr. Alicia.
Thank you. Muchas gracias, señora presidenta. Bueno, vamos a...
Thank you, Mrs. Chair. So we're going to proceed with the following chapters for adoption. So as we previously said in Section 5 on prevention and control, there is a chapter about trade, and I think it's the following chapter. It's the next chapter.
¿Cómo se corre para atrás? ¿La anterior? ¿Cómo se corre? ¿Cómo se pone para atrás esto acá en este? Sí, con este. Ya. Ya. Bien. Volvemos entonces a nuestra sección.
So we are now going back to Section 4. In Section 4, we had, in the code, there was a chapter 4.6, which is called contingency planning. And we think, I mean, it's a proposal that we are making, and we think it should be deleted because the measures that are recommended in this chapter have been taken, have been put as a whole, have all been put in chapter point X and point Y. So this is what I'm suggesting.
No comments. I present the standard for adoption. So are there any objections? Abstentions? No objections, no abstentions. So we confirm the approval of the standard. So thank you so much by consensus.
Gracias, señora presidenta. Bueno.
Thank you, Mrs. Chair. The next chapter is about Section 4. It's about the control of pathogenic agents in traded gametes and fertilized eggs. This chapter is about an improvement and implementation of better measures to mitigate the trade-related risks for this type of product. So we have a chapter about eggs disinfection. It's a chapter for risk mitigation, the risk that a pathogenic agent may come in. The president of the Terrestrial Commission already mentioned it. It's about the status of free compartment that we will discuss later. There hasn't been any free compartment. So it's a chapter about risk management. These are recommendations for the country, and we're going to work on some specific aspects, in particular for the countries which cannot benefit from the risk-free status for this particular disease. So it's a mechanism meant for trade, because today there is no similar mechanism, because this chapter has been supported by the industry. So it's a very good example of the work performed under private-public partnership. And under these partnerships, there's a lot of information that the scientific private sector can actually share with the public sector. So, Mrs. Chair, I am submitting this document for adoption.
I have Chile requesting the floor.
Mrs. President, Chair, Chile agrees with the adoption of this chapter. The goal is to provide guidelines for a safe trade of gametes, eggs, and semen. The recommendations are not really different from the already applied recommendations in Chile. We've had so far some very good implementation and to fight against the Nisa virus, and they were instrumental to control the disease. That the suggested measures are crucial to control pathogenic agents and the trade. Thank you very much.
The floor is yours.
Thank you. Republic of Korea supports this adoption for Chapter 4.Z. We would like to thank the Aquatic Animal Standard Commission for accepting our comment that fertilized eggs with detected pathogens should be treated in the biosecure manner. We believe that this chapter will provide important guidance to member countries to reduce the risk of disease transmission through trade in fish, fertilized eggs, and gametes. Thank you.
Thank you so much, Korea. I have a request from Uganda. Please go ahead. Floor is yours. Rose.
On behalf of the 54 countries of Africa region, we agree with this presentation on control of pathogenic agents in traded gametes and fertilized eggs of fish. This section provides risk management measures for trade in milked and fertilized eggs from non-free areas. It also includes biosecurity criteria for collection incubation centers. That is Article 4.Z+.6. It responds to members' demand for guidance on aquatic genetic material trade. This annex is linked directly with Annex 8 to 10, which operationalizes the guidance in disease-specific chapters and glossary. Its significance is crucial for facilitating safe trade of aquatic germplasm, that is registering growth of the continent as its aquatic sector develops and expands. Therefore, on behalf of the 54 nations of Africa region, we agree with this presentation. Thank you.
Thank you so much. India, please, you have the floor.
Thank you. India recognizes the importance of safe trade in aquaculture. The import of germplasm has an important role, significant role in enhancing fish breeding programs, improving disease resistance, enhancing productivity, and also preserving biodiversity. The new chapter will definitely help member countries to regulate ingress of pathogen, transmission of pathogen, genetic pollution, and biosecurity threat. India supports the inclusion of new chapter, control of pathogenic agents in traded gametes and fertilized egg of fish. Thank you.
Thank you so much. Any other comments? Back to you, if you want to comment.
Yes. Muchas gracias, señora presidenta. Quisiera...
Thank you very much, Mrs. Chair. So I'd like to thank you for your comments for both Chile, Korea, African regions, and India. And I do like the fact that you specified that this does contribute to possible genetic improvement in disease resistance. Dr. Funes talked about it during the forum on vaccination. He said that in aquatic animals, work has already been initiated in this field. It's about improving productivity, and this helps protect biodiversity. So thanks a lot for this. To me, it's very important that you can really make the most of this chapter.
No objections. Any abstentions? No abstentions. So we can confirm that this tender is approved and adopted by consensus. Thank you.
Gracias, señora presidenta. Podemos pasar.
Thank you, Mrs. Chair. Now let's move on to Section 5. Section 5. Oh, sorry. No, it's not Section 5. We're not in Section 5 yet. I mean, because we've made a few amendments and we had to include their recommendations on the new Chapter 4Z in the specific chapters for some, disease-specific chapters. So we performed an evaluation and we noted that Article 2.5, 2.10 and Article 10.4 and 15 and 10.80 under Chapter 410 for fish diseases had been impacted by Chapter 4Z, so we suggest that the Assembly may adopt this amendment for consistency purposes with Chapter 4Z. These are the transversal articles. Chapter 10.5, infection with salmonid alpha virus. Chapter 10.6, infection with infectious hematopoietic necrosis virus. And Chapter 10.10, BHS, chapters about infection with infectious salmon anemia virus. So all of this is proposed for adoption to ensure consistency with Chapter 4Z. So this is submitted for adoption.
No comments. So I present the tender for adoption. Oh, yes. Sorry. Hindia, you have the floor.
Thank you, Chair. India definitely supports the measures that enhance biosecurity in trade of fish gametes and eggs, but also would like to stress the need to protect its aquaculture sector and native populations. In the proposed changes, we can note that some of the disease mentioned like salmonid alpha virus, salmonid anemia virus are more relevant to the temperate regions. India would like to suggest that the revised article also should adequately address the diseases which are prevalent in tropical areas aquaculture. Thank you.
Thank you so much. Back to you, Dr.
Muchas gracias por su comentario.
Thanks a lot for your comment. Indeed, this chapter is based on the available scientific information, so it focuses on salmonid diseases, but I think it is relevant as part of the work of the Commission that we address the same articles and that we apply this for the tilapia disease, which is a major type of fish for trade and for sustainability and food in the world. So I suggest that we include this on the agenda of our September meeting, and I invite you to provide scientific and relevant scientific information because it's another cycle of reproduction, it's another type of species, so we have to take this into consideration regarding other diseases that affect salmons.
Already heard by Dr. Alicia, I present the tender for adoption. So are there any objections? No. Any abstentions? No. So I confirm that this standard is adopted by the
Gracias, señora
Assembly.
presidenta.
Thank you.
Thank you, Mrs. Chair. To finish with the various aspects addressed and for better understanding of some specific terms that were recently introduced in the code, I suggest that we have a new definition in the glossary. It's mostly in Annex Appendix 10 to define fertilized eggs and gametes, because Chapter 4Z is about gametes, and it's very important because it includes semen. It means that we could take these recommendations for our countries and we could include genetic improvements as it's already been made in for the terrestrial code, so we could align the risk management measures of the terrestrial code with the risk management measures of the aquatic code. So for this, in this regard, we have a new definition of collection center and incubation center. It's very similar to the terrestrial code. Well, actually, we used it as a basis. We have a center for fish breeding with high levels of biosecurity, and we may host eggs and semen and have them preserved in cryogenics, cryotechnics. So we have a new definitions of ornamental fish that is used in the following chapter that we will submit to your consideration and for adoption. These are the changes in the glossary. You may review.
Comments? Thailand, please, you have the floor.
Thank you. Thailand would like to highlight according to the new Chapter 5.x, movement of ornamental aquatic animal. Managing pathogen risks associated with the movement of ornamental aquatic animals is important at every stage of the complex supply chain. Not only aquatic animals supplied for sale as pets, but also those that are used, owned, or kept as pets, present opportunities for the transmission of pathogenic agents. Therefore, we propose that the WOAH amend the definition of ornamental aquatic animal for better clarity. It should be revised to read, ornamental aquatic animal means an aquatic animal that is intended for display, exhibition, competition, supply for sale, and use as a pet. Thank you.
Thank you so much for your comment. Do you want to say something?
Muchas gracias por el comentario.
Thank you very much for your comment. So, indeed, the definition specifies that an aquatic animal is
intended for display, exhibition, competition, or to be supplied for sale as a pet. So I think it's covered. Thailandia, what is the new suggestion?
Thailand, please. Do you have a suggestion?
The new definition, ornamental aquatic animal means an aquatic animal that is intended for display, exhibition, competition, supply for sale, and use as a pet.
No, and use. ¿Cuál falta? Instead, es que for sale as a pet, for sale and use as a pet.
Ah, okay, okay. Gracias. Thank you, Thailandia. We could, Secretaria, dear Secretaria, maybe to add for sale and use as a pet. I think it's a very good contribution para venta y para uso como mascota.
For sale and to be used as a pet. So can we adjust the resolution to include the comment from Thailand, because it's very important? Thank you very much.
Any comments? So let's present the standard for your adoption. So are there any objections? No. Any abstentions? No. So I confirm that the standard is adopted by consensus. Thank you. You can move forward, please.
Muchas gracias, señora Presidenta.
Thank you very much, Mrs. Chair, and thank you for your contributions. Now, we have to review Chapter 5.x. So we are leaving Section 4 behind us. Section 5 is about trade as defined in the terrestrial code. We have 5.x because we don't know exactly where it will be placed. It's a crucial chapter for those who've been working with aquatic animals. And during the World Conference in Chile in 2019, we stressed the significance of this chapter and subject because there's always a risk that some pathogenic agents may be introduced through trade. So what is very important, it's very important for ornamental species. So this chapter is based on the risk analysis model, and the latter is based on Chapter 2.1 for the import risk analysis, and it provides guidelines for the countries after risk analysis is performed, and then they can implement mitigation measures in the country where we ship aquatic animals at the border of the importing countries and after the border in the importing country. These are basic guidelines, general guidelines, so that countries can perform their own risk analysis. And it also includes the concept of the listed diseases and also diseases which are not on the list yet, but there's always this very notion of risk analysis in this perspective. And in the disease-specific chapters, there's also the possibility to take additional mitigation measures. Dr. Etienne this morning talked about risk analysis, and that's a very good example that we need to take risk analysis for the import of ornamental species. And the countries, the importing country mostly, the importing country could actually review the legal requirements. And this is very important in order to help veterinary services to follow a very logical flow. And that's a chapter that was circulated on numerous occasions, and we catered for all the comments that you made. And we are submitting this chapter to the General Assembly.
I have a request from Chin Eswatini. I can't see the last one, but we will come back.
Gracias, señora presidenta. Chile agradece el desarrollo del.
Thank you, Mrs. Chair. Chile wants to thank you for working on Chapter 5 on the movement of ornamental aquatic fish, because this was issued as a recommendation during the 4th Global Conference and in the report from the Commission for Aquatic Animals. We need instruments to develop the safe trade of ornamental fish through risk analysis and relevant mitigation measures in each country.
Yeah, thank you, President, for giving me the floor. I take it on behalf of the 54 African countries. First, to congratulate the Aquatic Code Commission for the sterling work that you have done so far. This year's volume of the work is really proof that there is a lot of commitment from the Commission. Thank you very much for that. Africa welcomes this chapter since it provides a risk-based framework for management of disease risks associated with ornamental animal trade. Also, the introduction of the term ornamental aquatic animal is welcome. Indeed, the ornamental fish value chain is different, runs parallel to the aquatic food value chain. Africa is a major trader or exporter of ornamental fish. It also imports some ornamental species, particularly the koi. Ornamental fish keeping is also growing across the continent. Most of the ornamental fish and other aquatic animal taxonomic groups is exported from the wild populations caught from transboundary water bodies. They may be infected with transboundary animal disease and consequently transmit to the aquatic food value chain. It is in this regard that this chapter fills a gap that has been there for a long time, and Africa supports the adoption. Thank you.
Thank you so much. Now I'll give the floor to Peru.
Thank you very much, Mrs. Chair. For Peru, we are very happy this chapter was presented. We know how difficult it was to get to this achievement. And as we import, but also export ornamental fish to neighboring countries, I can tell you that over the last few years, we conducted more than 137 risk analyses, and this chapter will be very helpful to make sure that future assessments are more robust so that we can offer more safety and preserve the health safety status of our country.
To share with us. Do you want to answer the comments?
Sí, muchas gracias, señora presidenta. Justamente estamos muy agradecidos.
Yes. Well, we are very happy with these comments because the purpose of this chapter was to support competent authorities. We wanted to follow the chain from risk analysis carried out by a competent authority from the central to the local level. So I wanted to thank all the countries that contributed to this chapter, and now it's very important this chapter is implemented.
Adoption. Are there any objections? No. Any abstentions? So I confirm that this tender is approved by consensus. Thank you.
Okay, maybe. Okay. Okay.
We have a comment from Canada, please.
Yes, apologies for the late intervention, but we would like to request clarification on the impact on the chapter with the change in the definition of ornamental aquatic animals. This type of change on the floor makes it difficult for members to evaluate the implications on 5.x. Thank you.
Please, if you could give us your views on this, Dr. Alicia.
Thank you, Canada, for this observation. So after the introduction of this, well, what it does is that it talks about selling and using this type of fish, as if these were exhibition fish. So it's not something that we add, it's not a verb that we add, and I don't think it has an impact on the chapter, but this is something that we can revisit in September when we meet. But from the reading, my reading, it would have no impact on the general principle of the chapter.
No? Okay, thank you so much. So we can proceed, please. Dr. Alicia, yes?
Okay, sigo allá. Bien, entonces ahora vamos a...
Okay. Okay, fine. So now we have this annex. The periods for basic biosecurity conditions, i.e. when all alert and early detection of a disease are what we call basic biosecurity conditions. And in each specific chapter, there was a predetermined period to fulfill the basic conditions of biosecurity, as well as the conditions for targeted surveillance. For some chapters it was 1 year, for others it was 2 years, for yet others it was 10 years. So the Commission, in the past, the Commission decided that it would be very important to support this with scientific evidence and understand why we had certain periods for such disease and other periods for other diseases. So we worked with a consultant specialized in aquatic animals, whom we want to thank for their support, and they gave us a classification of all periods depending on the pathogen. They define pathogens that can spread very quickly, and therefore the periods are much shorter, and you can quickly identify the presence of the disease. Then they defined other pathogens that have a longer spreading period, so we adapted the chapters according to the recommendations that were issued by this consultancy firm. And then we also had chapters that were pending since 2022, because what led to this analysis was the chapter on vigilance. And this chapter on vigilance recommends 4 types of reporting for the countries. This morning I was in the Terrestrial Animal Commission meeting. There are some differences with ours, but there is the absence of species with the disease, then the historic absence of the disease, no case in history, then there is specific surveillance or targeted surveillance, and then there is the fact that once you have an outbreak, you can recover your free status once you have gotten rid of the disease. So we started from this technical document, and we decided to review each specific chapter, and more specifically items 5, 6, and 7, and we referred to a disease-free country. How long does it take before we can declare that a country is disease-free? And what are the biosecurity measures that need to be put in place? And what are the targeted surveillance conditions? All this is based on a chapter which has been much debated. Some of you might remember that. And many experts contributed to this chapter. And thanks to this annex, we propose that we take into account the overarching modifications to Chapter 5 to declare a country that is free or a zone that is free. Article 7, compartment which is free of infection. And we also reviewed the 30 chapters specific to diseases. So that's an improvement so that countries can move forward and go for this reporting of free status using our definitions, but also using scientific evidence based on the information that we have available so that they can justify the periods they have, and we have no predetermined periods of time. Mrs. President, I am ready to listen to comments from the audience.
Señora Presidenta, en nombre de los 33 miembros de
Mrs. President, on behalf of the 33 countries in the Americas, we see that the possibility for countries to report, to declare they are free of Iulardis Solamnis based on historical data was cancelled during our latest round of discussion. And this latest change in February 2025 was due to the fact that there were concerning clinical signs. So the 33 countries in the region of the Americas can't support the adoption of this chapter without providing historical freedom in chapters 10.3.5 and 10.3.6. We agree with the Commission to say that the route for historical free status cannot apply to certain diseases, just like ASA, HPRO, but for Dartimus salaris, where at least one of the species which is susceptible would show clinical signs in certain environmental conditions, well, it should be possible to explain why they can opt for Route 2. And we observe that for other diseases, there are susceptible species that may not show signs, but they can be infected and have pathogens. So then the responsibility of demonstrating that Celodactylus salaris is present, this should be detected via the early alert system, and that must be done by the different members. Okay, Uganda.
And then United States.
Thank you, Chair. This is for Africa again. And I'm the Vice President of the African region. Africa region agrees with the adoption of periods of basic biosecurity conditions and targeted surveillance. We think that the revised article XX5 to XX7 and in addition, the 110.4.5 and 10.4.10 or to 10.4.5 across all the disease-specific chapters. Updates, this chapter, the revision updates the surveillance and biosecurity period requirements based on the risk criteria in the revised chapter 1.4. It also includes the tailored assessment for each disease, including new diseases like megalocytovirus, pagrus. Therefore, this is significant because standardized timeframes of disease status recognition essential for trade certification and zoning. Africa, all the 54 nations of Africa, therefore, agree that this Annex 12 is adopted. Thank you.
Thank you so much, Uganda. I'll now give the floor to Canada, please.
Thank you. I stand on behalf of the Quads Alliance to express support for the request by the 33 members of the region of the Americas. We agree that Pathway 2, which enables the use of historical freedom for declaring freedom from infection with Gyrodactylus salaris, should be reinstated in Articles 10.3.5 and 10.3.6. It is our understanding that the Commission's rationale for removing this historical freedom pathway was because clinical disease is not observed in all species susceptible to infection with Gyrodactylus salaris. However, we note that species susceptible to other listed diseases of aquatic animals similarly may not exhibit clinical signs under certain environmental or biological conditions. Therefore, infection with Gyrodactylus salaris is not an exceptional example, and removal of this pathway for this pathogen specifically could create internal inconsistencies within the code. We also note that Chapter 1.4 already accounts for the option to provide additional data from targeted surveillance to strengthen historical freedom claims via Pathway 2 if some susceptible species don't show clinical signs to a given pathogen of concern. These provisions in Chapter 1.4 already address the Commission's concerns. President, if I may, I have another intervention on this particular annex. Thanks. So on behalf of the 33 members of the Region of the Americas, we would like to recognize WOAH and the Aquatic Animals Commission for their efforts to complete this large piece of interconnected work over the past number of years, which has culminated in the review of disease-specific time periods for basic biosecurity and targeted surveillance for each pathway for freedom outlined in Annex 12. The 33 members of the Region of the Americas will not be able to support the adoption of this annex without a change to the time period outlined for targeted surveillance for ISAV HPR 0 in Article 10.4.9.1 from 1 year to 2 years. ISAV HPR 0 is transiently detected in stable populations of Atlantic salmon and most readily detected during stress events such as spawning. However, knowledge of the epidemiology of ISAV HPR 0 in land-based aquaculture establishments such as compartments is limited. Because of uncertainties surrounding the epidemiology of ISAV HPR 0 in land-based commercial Atlantic salmon systems, Canada requires 4 surveys over 2 years for ISA HPR 0 to establish freedom within a recognized compartment. Even with this testing regime, Canada has experienced a facility that had met the compartmentalization biosecurity requirements that tested negative 3 times, but then had a subsequent positive detection on the 4th survey in year 2. Under the new time period proposed for targeted surveillance, this facility would have become a compartment, even though HPR 0 was present at a low prevalence. It is this practical example that supports the Region of the Americas' position that 1 year of targeted surveillance may be insufficient to detect ISAV HPR 0 to support a freedom declaration in a compartment. Thank you.
Thank you so much for your comment. Now I give the floor to the United States of America.
Thank you very much, Madam President. On behalf of the Quads Alliance, we support the 33 members of the Region of the Americas' request to change the time period outlined for targeted surveillance of infectious salmon anemia virus HPR 0 from 1 year to 2 years in Article 10.4.9.1. We agree that increasing the period of surveillance is necessary to establish freedom from this pathogen at the compartment level because it is transiently detected in stable populations of Atlantic salmon, and the epidemiological information available for ISAV HPR 0 is limited in land-based aquaculture establishments, including compartments. Thank you.
Thank you so much. Any other comments? Okay, we will hear from Dr. Alicia.
Muchas gracias por sus comentarios. Bueno, tengo una buena noticia.
Well, thank you for your comments. 2 news, a good news and a bad news. Over the 30 chapters that we submitted for comments, we had problems with just 2. So that's good. 2 chapters. And with regards to what Canada said, I understand what they said, but we want to maintain consistency between the different chapters in the code. And it's very important we have no discrepancies. So we have two diseases. Infection with Galeradistus salaris, which is a parasite, and there you have 6 species which are susceptible as listed under Article 2. And Samo salar can show clinical signs, lesions, or even mortalities. The other 5 species would show no clinical signs if we refer to the available scientific information that we have and that we collected from Norway. And they said, well, it all depends on the number of parasites, and this will determine whether you can see clinical signs or not. So, as you said, the surveillance and biosecurity periods is a notion that appears in Chapter 1.4 when we talk about passive surveillance. This article clarifies that we need to have the possibility to observe clinical signs. And if these clinical signs cannot be observed, then the sensitivity of passive surveillance cannot cover for the residual risk. And that's very important because we're working on 2 complementary chapters. As a consequence, and I think this is what Africa said, there are other diseases included in the code for which the conditions are the same. And it's good that countries raise the alarm. And apart from this parasite, there are others, and we need more scientific information. Maybe an alternative solution, considering this is a very important topic for the Commission to defend the free status. One alternative would be to allow countries to provide more background information about Salaris infections and see how we can better implement 1.4. How can we implement passive surveillance? Maybe by combining it with active surveillance, which is not very much described at the moment, but this so that we can guarantee that through route number 2, we can guarantee the free status. So, Mrs. President, I offer an alternative so that in case there is an infection with Salaris, we can start discussing this topic in September when we have our meeting. This will give us the opportunity to ask for more information, and route 2 would be studied pending we get exhaustive information and exhaustive, robust information. So that's our proposal for the infection with the Salaris virus. Now, for infection with infectious anemia, it's very close to influenza in terrestrial animals. So you have 2 variants, HTPR and the other variant, which is 0 variant, which does not lead to any clinical signs. But as Canada said, compartments which are free allowed them to measure things, and they realized that it's not just 1 year, that they need 2 years, because after 2 years you have a peak in the disease. And from another perspective, it's also true that if we want to be consistent, we need to have more studies and we need to have more scientific background. So the Commission for Aquatic Animals works with ad hoc groups and works with experts in collaborating centers. We have 2 centers for the salmon infectious anemia, one in Norway, the other one in Chile, and we have another center for the Salaris virus. So that would be an opportunity to bring them together along with other experts and have them contribute more scientific information so that we can debate this in September. As for the article 10.4, in this article, when we talk about compartmentalization, I suggest that this is studied further. In other words, given the complexity of these topics, which had not been envisaged in the code before, my suggestion is that we continue analyzing things so that we can address these two diseases, and they would be under the mention under study. For which, and then there could be comments.
Please, go ahead.
Thank you, President. I wondered if I could just get clarity. Would both issues then be under study? Thank you.
Any other comments?
Thank you very much, Madam President, and thank you very much for the opportunity for further study on both of these diseases. That gives us the ability to have confidence in the way we move forward. Thank you.
Thank you so much. Chile, please.
Thank you, Mrs. Chair. Chile wants to thank this flexible proposal to place these two topics under study, so we agree with that.
It's a very good proposal because accepted by the delegates. So let's go and present the standard for adoption. Are there any objections? No. Abstentions? No. So I confirm that the standard is adopted. You can move forward. Thank you.
Muchas gracias por su aprobación de la propuesta. Vamos a continuar.
Thanks for approving our proposal. I still have 100 slides. No, just kidding. Annex 12. That's done. No, I was just joking. I was just joking, says the speaker. So, we asked the ad hoc group to meet and assess new susceptible species based on chapter 1.5. And there was a chapter that we analyzed already during our last session, which was 1.5.9, which, well, this is something we'd never analyzed before, but when more than one species is susceptible, meaning that the pathogen does not make any discrimination with susceptible species, then we apply the upper taxonomy category. So we list a family, and it, in line with the implementation of Article 1.5.9, we introduced a modification to Chapter 9.9 on infection with white spot virus, which affects crustaceans. So we updated Article 2 when it comes to the list of susceptible species. So, Mrs. Director, I'd like to thank the work of the observatory, because now we can introduce, we can type in the species in the search engine, and then we get all the chapters where the name of the species appears. And for a disease like this one, that affects a large number of species, I think that all countries will be very happy they can search on standards thanks to this tool prepared by the observatory. So now, Mrs. President, I'd like to have the comments from the delegates.
No, I have there, Thailand.
Thank you, Chair. Thailand wishes to raise an issue concerning the appropriateness of the list of susceptible species in the disease-specific chapters of the Aquatic Code and Aquatic Manual, particularly regarding the white spot syndrome virus or WSSV and Anaphanomyces invadens, commonly known as epizootic ulcerative syndrome or EUS. For WSSV, Plenary and Opportunity are listed as susceptible species at the family level, while Panulilus spp is listed at the genus level by the Aquatic Commission. However, according to the report of ad hoc group, Plenary, Opportunity, and Panulilus spp are recommended to be listed at the species level based on the limited number of species exist. A similar issue also arises for EUS, where China spp is listed at the genus level. Currently, there are no established criteria by the Aquatic Commission for determining whether a species proportion within the taxonomic group is representative enough for applying Article 1.5.9. Therefore, Thailand would like to request WOAH to keep the listing of susceptible species at the species level in provision for listing of susceptible species in the Aquatic Code and the Aquatic Manual for Plenary, Opportunity, and Panulilus spp in relation to WSSV, and for China spp in relation to EUS, to ensure that the listing of susceptible species exists and concluded based on scientific evidence. Thank you.
Thank you so much for your comment. I have a request from Uganda. Please go ahead.
Thank you, Chair, and thank you, Presenter. Again, on behalf of the 54 nations of Africa region, for Annex 13, 9.92, infection with white spots syndrome virus, we think the revision updates the susceptible species list using Article 1.5.9. That's taxonomy-based approach, which is appreciated. We also think that see that the review integrates feedback from members and ad hoc group. This revision aligns with the Annex 22 in the Aquatic Manual. Therefore, it's significant because it strengthens the clarity and reliability in surveillance of one of the most important crustacean diseases. Therefore, we accept that we adopt this presentation. Thank you.
Thank you so much. Any other comments? No, please. I will give you the floor for your comment.
Muchas gracias, África, por su comentario.
No, sorry, because we have a request from. It'd be better to wait.
Thank you, Chair. India, being a major shrimp producer, has a strong, very deep interest in accurate, correct, and updated information on WSSV susceptibility. We strongly support revisions which are based on scientific evidence, as this directly affects any nation's ability, any country's ability to manage and control the WSSV outbreaks. Thank you, Chair.
Thank you so much. Any other comments? No, I will give you now the floor for your answers, please.
Gracias, señora presidenta.
Thank you very much, Mrs. Chair. Thank you for your comments. Indeed, the infection of white spots is one of the most notified disease in crustacean species, as we saw it yesterday. It is rather complex because there are many species that are susceptible and that have incomplete susceptibility. So it's very important to have an update that is based on science. Regarding Thailand comments, thank you for it. We will include it in the agenda and we will address it during the September meeting. It is important to see if we can actually improve it, but I suggest at the meantime, because the scientific information that we have is very robust, I suggest that we submit this to your consideration.
And for your adoption. So are there any objections? No. I have, yes, from Thailand.
Yeah.
You want to, yes, you want to, the floor. So please, floor is yours.
Thank you, Chair. May I clarify that? So this issue is going to be under study, is that correct?
Sí, muchas gracias, Tailandia.
Yes, thank you very much, Thailand. We are going to read your comments and we will respond to these comments during the September meeting, and it will be based on the analysis and information available during the meeting.
For the adoption.
Sí.
Okay, it's that clear for you, Thailand? Okay, let's move on. So, no objections. Are there any objections? Abstentions? No abstentions? Abstentions from Thailand, please. No more abstentions. So the standard is adopted. You can move forward.
Muchas gracias, señora presidenta.
Thank you very much, Chair. Mrs. Chair. So we are now going to move on with the next part. So the following chapters are focused on the same topic to include susceptible species based on the information provided by the ad hoc group for both crustacean species and fish, Annex 14 with Articles 10.21 and 10.22 of Chapter 10.2 infection with Aphanomyces invadens, episodic ulcerative syndrome. And, of course, Article 1.5.9 that we so it was based on the recommendations from the September meeting. So during the meeting we applied the same approach and we used the same basis of comments to standardize the assessment of this article. So we reviewed the list in full line with the recommendations provided by the ad hoc group. I am submitting this text for adoption. It's Annex 14.
No comments, so I propose the standard for the adoption. Are there any objections? No objections. Abstentions? From Thailand, 1 abstention. So the standard is approved, adopted by the Assembly. Thank you. You can move forward.
Gracias, señora presidenta.
Thank you very much, Mrs. Chair. So Annex 15, it's about Chapter 10.4 of infections with salmon anemia virus. Many countries reported some terminology discrepancies compared to for the Spanish and French versions, and the Commission reviewed the 2 versions and we amended the problems reported by the countries. So I'm submitting this annex to your consideration.
Comments? No comments. So we can present the standard for adoption. Are there any objections? No. Abstentions? So I confirm that the standard is adopted by the Assembly. Move on, please.
Gracias, señora presidenta.
Thank you, Mrs. Chair. So it is a great honor and real pride for the Commission. So after a year, we all agreed to include infection with megalocyte virus Pagras 1 in the list. So there's the corresponding chapter in the code. So the member states were submitted with important information on this disease. And on the website, a note about this disease is available. But in the meantime, the specific chapter for diagnosis test will be prepared for the manual. So we took this opportunity to review the list of susceptible species within the ad hoc group. And this disease has 3 genome groups, and one had already been listed. So we were able to retrieve information from the ad hoc group and introduce this information based on the latest scientific evidence, based also on Article 1.59, based on the report provided by the ad hoc group, and also based on the comments from a few countries that noted back in September that we have to focus on the risk, the species, but also their places, their distribution, and eventually we applied this specific approach for the new chapter for this new disease in the list of the aquatic code. Mrs. Chair, I'm submitting this for approval, adoption.
Comment from Thailand and Chile.
Thank you, Chair. Thailand would like to point out that the scope of the draft new chapter 10.x, infection with megalocyte virus Pagras 1, includes infection with the 3 genome groups, namely Red Siberian iridovirus or RSIV, infectious spleen and kidney necrosis virus or ISKNV, and turbot radish body iridovirus or TRBIV. The current aquatic manual needs to be updated to include the validated diagnostic methods applicable to viruses within all 3 genome groups. Besides, regarding requirements on the self-declaration of disease freedom for country, zone, or compartment, from infection with megalocyte virus Pagras 1, supportive evidence such as disease surveillance information is required to demonstrate freedom using the validated diagnostic methods and case definition outlined in the revised aquatic manual. Therefore, Thailand would like to propose the WOAH postpone the adoption of the draft new chapter 10.x, infection with megalocyte virus Pagras 1 of the aquatic code until the revision of chapter 2.3.7 of the aquatic manual is completed. Thank you.
Thank you so much for your comment. We have Chile. You have the floor.
Thank you, Mrs. Chair. So Chile is thanking the Commission and the ad hoc group for this excellent work that was performed in order to draft Chapter 10.x that provides crucial measures for biosafety applied to imports and to the report of disease-free status, notification of disease-free status. We're happy to see that this was applied. So it's definitely a step forward for the protection of this status for safe trade.
Anna, please.
Thank you very much. China supports the WOAH Aquatic Animal Health Standards Committee to list the infection with megalocyte virus Pagras 1. This is an important passenger affecting freshwater and marine fish worldwide. To put it in the list will help to prevent and control the disease at a global level, preventing its further spread and causing greater damage to aquaculture and ecology. WOAH has established a special working group to comprehensively evaluate and validate diagnostic tests. We are looking forward to the publication of the manual chapter as soon as possible. Thank you.
Thank you so much. Now, Australia, please.
Australia commends the Aquatic Animal Health Standards Commission for its work to improve the Aquatic Code and the Aquatic Manual. We fully support the Commission's diligent approach to completing a new chapter for infection with megalocytovirus Pagris 1 within 1 year of adoption of the disease listing. Australia also acknowledges the Commission's ongoing work in updating the diagnostic standards of the Aquatic Manual, including the preparatory work to develop a new chapter for infection with M. Pagris 1. We understand that this new chapter is being developed through international collaboration amongst diagnostic experts for M. Pagris 1, including Australia's National Reference Laboratory, the Australian Centre for Disease Preparedness. Australia will provide its ongoing support for this important work. Thank you.
Thank you so much. Now, Uganda.
Thank you again, Chair. On behalf of the 54 nations of Africa, we say that this draft, Chapter 10X, on infection with megalocytovirus Pagris 1, introduces a new disease-specific chapter to replace Red Sea bream iridovirus. It also lists susceptible species using ad hoc group findings, including Pachylates, that one. This revision supports the new disease surveillance and complements aquatic manual updates. It's significant because it facilitates early detection and safe trade of susceptible fish in an emerging disease area. Thank you.
Thank you so much. Any other comments? No more comments. Back to you, Dr. Alicia.
Muchas gracias por los comentarios. Thank you very much for your comments. I agree with the African representatives. The non-scientific names are very hard to pronounce, so I won't try again. But I have to say that for us, it's very important to have a list with this disease included, because we paid close attention to the recommendations of the countries regarding trade, and the code provides for guidelines with a list of susceptible species from Article 2, and as well as guidelines to have a disease-free declaration. But after the September meeting, we all agreed to set up an electronic ad hoc group with various experts from various regions in order to validate the diagnosis technique. And we work with different countries. I mean, it's quite similar to what we've done with tilapia disease, where all countries did collaborate with reference material. We were able to perform a test between labs in order to validate the diagnosis that is mentioned in the relevant chapter in the manual. Mrs. Chair, thank you very much for your comments. And this chapter provides the relevant guidelines to manage the risks, and why we were working, we'll be working with the ad hoc group, and in the meantime we'll make a proposal for the manual as soon as possible.
I can't see any requests for comments, so I will propose the standard for adoption. So, objections? Thailand? Okay. Any abstentions? No abstentions, so I confirm that the standard is adopted.
Gracias, señora presidenta. Vamos a pasar.
Thank you very much, Mrs. Chair. We won't last very long. So following the introduction of this new chapter, we suggest we may remove the current chapter 10.8, infections with iridovirus of the Red Sea bream. It's very hard to pronounce, I apologize. 10.8, chapter 10.8. So I suggest that we open the floor for comments.
No comments. So I propose the standard for adoption. Any objections? No. Abstentions? Okay. Adopted by the Assembly.
Gracias, señora presidenta. Pasamos.
Thank you, Mrs. Chair. So now let's move on to Annex 17. It includes the chapters for relating to infection with vacancies already, and that is consistent with the recommendations from the ad hoc group regarding susceptible species. So it's another chapter, and so this change is submitted for your comments.
So standard is for adoption. So any objections? No. Abstentions? No. Adopted by the Assembly. Can move forward.
Muchas gracias.
Thank you very much, Mrs. Chair. So now it's about Annex 18, which Chapter 11.7, infection with Xenohaliotis californiensis. So we amended Article 2, susceptible species. Now we are submitting this change for your comments.
Propose the standard for adoption. Is there any objections? No. Abstentions? No. So adopted by the Assembly.
Muchas gracias. Bueno, terminamos el código y pasamos a los textos.
And so let's finish with the code. So these are the texts submitted for approval in the aquatic manual. There are 6. Many of them refer to the consistency with susceptible species from the code, and we included 2 new chapters in order to move forward to adapt it to one single format for the various chapters in the manual. So here we have Annex 22, and it allows to be consistent with the code regarding susceptible species that have been included in the code. And that relates to the matching chapter regarding infection with white spot syndrome, the white spot syndrome virus in crustacean. So we updated the list of susceptible species based on the guidelines from the ad hoc group. So I'm submitting.
No comments. So I present the standard for your adoption. Are there any objections? No. Abstentions? From Thailand? Thank you so much. So the standard is adopted by the Assembly. Can move forward.
Okay. Muchas gracias, señora presidenta. Vamos a pasar al anexo 23, también congruente con...
So, Annex 23, to be consistent with the code chapter 2.2.2, infection with episodic ulcerative syndrome. So I'm submitting this to your comments.
No comments. Present the standard for your adoption. Are there any objections? Abstentions? Thank you so much, Thailand. And so I confirm the standard is adopted by the Assembly. Thank you.
Muchas gracias, señora presidenta. Pasamos a... Son dos capítulos.
Thank you, Mrs. President. Now we move to Annex 24, and that's incorporation updated with WOAH reference laboratory experts. So we use the format that we used in the disease-specific chapter template. We also completed table 4.1 and aligned it with the case definitions in the section 6 with diagnosis clarification for animals which are suspected of being infested or animals showing clinical signs, or when you have suspected or confirmed cases in section 6. And we thoroughly revised the entire chapter. So this annex is submitted to comments.
You have the floor.
Thank you, Mrs. Chair. I speak on behalf of 27 member states of European Union. The EU can, in general, support the adoption of proposed Aquatic Manual Chapter 24, but also I would like to maintain in my intervention also Article 20, not Article Annex 25. So, generally, we can support those two chapters, annexes. However, as regards to annexes 24 and 25 on Bonamia exitosa and Bonamia ostre, the European Union considers that the proposed confirmed case definitions for apparently healthy animals and clinically affected animals could be potentially increase the number of false positives, as merely a positive specific PCR test results could be considered as a positive case. Therefore, the European Union requests the Aquatic Animals Commission to revise the case definition at the next meeting of the Aquatic Animals Commission in September 2025. Taking into account the written EU comments that have been submitted to WOAH prior to this general session. Thank you very much.
Thank you, Poland. Are there any other comments? Okay, back to you, Dr. Alicia, if you want to answer.
Muchas gracias, señora presidenta. Gracias, Polonia, y a los países de Europa. Nosotros.
Thank you, Mrs. Chair. Thank you, Poland, and thank you to the European countries. So we propose this annex for adoption, but we'll review your comments. And we included a PCR test plus another diagnosis test in order to have a greater sensitivity when it comes to detecting the cases. But yes, we will review the comments that you sent to us.
Now, Chapter 2.4.2. Annex 24 for the adoption. So are there any objections? No abstentions? So adopted by the Assembly. And now we can move forward. Annex 25.
Gracias, señora presidenta. El siguiente capítulo.
Thank you, Mrs. Chair. We are now talking about infection with Bonamia ostre. And we just talked about Bonamia exitosa, and I offer Annex 25 for adoption for cases of infection with Bonamia ostre, which is in the same genus. And we just adapted the definition of cases, and we have a new disease-specific template.
Propose the standard for adoption. Are there any objections? No objections. Abstentions? No. So I confirm the standard is adopted. Annex 26 now.
Muchas gracias, señora presidenta. Entonces pasamos a...
Thank you, Mrs. Chair. We now move to Annex 26 and Chapter 2.4.6, which deals with infection with Pechinus orsini. We adapted this chapter and we modified sections 2.2.1 and 2.2.2 with regards to susceptible species and species with incomplete susceptibility. So here is the annex, and we'll take your comments.
No comments. Propose the standard for adoption. Are there any objections? No. Abstentions? No abstentions. So the standard is adopted by the Assembly.
Muchas gracias, señora presidenta.
Thank you, Mrs. Chair. We now have Annex 27, which is also a revision on the list of susceptible species as a response to the ad hoc group's comment on infection with Xenohaliotis californiensis. Any comments?
Standard for adoption. Are there any objections? No abstentions? So the standard is also adopted by the Assembly.
Muchas gracias, señora presidenta.
Thank you, Mrs. Chair. So we have completed the chapters that we wanted to present to your consideration. There is one chapter or one question missing that I need to ask you with regards to our working plan, but we wanted to tell you that we are presenting a new collaborating center, which is very important because all technical questions are addressed by these centers. So we're talking about the Aquatic Animal Health Laboratory from India and the designated expert is Dr. Pravata Kumar. So we are delighted to present this for consideration. We are also presenting another reference lab for infection with iridescent virus 1, so DIV1. So this would be the Division of Maricultural Organism Disease Control and Molecular Pathology, Yellow Sea Fisheries Research Institute from the Chinese Academy of Fisheries, and the designated expert is Dr. Lian Q. So we submit this to your consideration.
You can move forward.
Apreciamos mucho el apoyo de los centros colaboradores. Gracias.
So we want to say how much we appreciate the support from these centers, and thanks to the countries that support us. We also added the comments that we received about our working plan. So we prioritize certain items based on what needs to be improved in the standards for the aquatic and terrestrial codes. And we need to see what kind of benefit it can bring along for members. We talked about this yesterday when we talked about the report from WOAH. We know that some diseases are more reported than others, and we received high-quality comments from all the members, and we also took into account the WOAH strategies for aquatic animals, and we looked at the capacities that we need to strengthen. There are many capacities focusing on the improvement of diagnosis systems, and there were comments made by the teams at headquarter levels that were very useful, and there were comments from the Commission. So what's the work program that we suggest? Well, first, we want to finish our work on Section 4, which is absolutely relevant for disease prevention and control. We want to consider the updating. So, of course, we want to thank you for adopting all these chapters, but we also want to see whether it would be possible to include topics like zoning. So we are currently working on a new chapter, 4.3, on compartmentalization, and we'll talk about this during our next general session. It would be very important for the Aquatic Commission to promote these standards in favor of self-reporting of the disease-free status. And then we will also work on updating the chapter on zoning. But we received comments from member states asking that we make progress on Section 5. that encompasses trade measures. And that's aligned with what Cristobal explained. So that's chapter 5.3. And once again, we are going to align with the terrestrial code. We are going to follow their work program with the introduction of section 5 and a few modifications with regard to the e-health certificate. And then we are going to work on chapter 5.3 with regards to certificates for international trade. So for us, it's important we support the same things as the terrestrial Commission. We need to provide countries with guidelines so that they can get the free status for a country, for a zone, for a compartment, so that trade can be safe. We are also going to continue working on chapter 1.5, which is specific to diseases, in order to collect more scientific information and support countries in the case of susceptible species. For the manual, we want to continue working on the process because it's very helpful for all countries to have the same format for all diseases. Then 1.5, that's exactly the same thing as what we are going to do with the code. And then I'd like to take into account one comment that was made by some countries with regards to AIHNV, which is a disease in crustaceans. And one country offers a diagnosis technique that allows differentiating the endogenic material of the virus, which is included in a genome. And this technique is called EVE. So we accepted this recommendation, and the Commission wants to encourage cooperation and transparency, and this is why we called for a consultation with experts, with reference labs, but also with other regions in order to take into account the specificities of each region. This comment was made on a regular basis. And as the group has been established, we believe it's important we can test a model of expert group working on a specific disease, which is one of the most reported disease, which creates some challenges in terms of diagnosis based on the situation in each country. So we want to move forward on chapter 4.3 for the application of compartmentalization, Annex 19. We want to move on with the glossary terms to define compartment. And we want to move on chapter 4.7, which is following in aquaculture. So we've seen that because we've included a few things about disease management, but we put this here to get your comments by the beginning of July. Then for the manual, infection with Perkinses solseni and infection with Xenohaliosis californiensis. These are annexes 28 and 29 that we will present to you in the coming weeks. And on July 4th, 2025, that's your deadline to send us your comments. You've done things wonderfully well so far, and I want to thank you for the comments that you already sent after the last meeting. But now I just wanted to take a few minutes to thank all the men and women working in aquaculture, and more specifically women, because they have a major contribution in aquaculture. So I'd like to recognize the huge contribution of women, both in the private and the public sector. And very often, women working in this industry have families. So we want to thank our families, because our families sail the same oceans of standards as we do. And my son is 34, and he is sailing with me on this ocean of aquatic standards. Thank you.
Much, Dr. Alicia Gallardo. Thank you for the Commission, of course, also for this work, this intensive work, and also for the enthusiastic way of explaining all these chapters to all of us. And of course, thank you to the delegates for the contributions that you made during this afternoon. And I really, before I hand over to Montse, I really would like to remember, I have a request there. Well, 3 requests, okay, lots of them. So, Norway, then Peru, Ecuador, and Chile. Okay, Norway, please.
Thank you, Mrs. President. Norway would like to thank the Aquatic Commission for its dedicated work and its President for inclusive communication. The work is essential to ensure the health and welfare of our aquatic animal populations throughout the world. Norway will continue to support the work of the Commission in any way possible for continued improvements of the Aquatic Code and the Aquatic Manual. Thank you.
Thank you so much, Norway. Peru?
Thank you, Mrs. President. On behalf of Peru and on behalf of the countries in the Andes, and on behalf of experts working on aquatic animals, we are asking the Commission to include a new strategy for WOAH on aquatic animal health that would include the results and the outcome and what we learned from the 2025 strategy. We need this strategy to strengthen the vet services, and we need it to contribute to raise awareness amongst decision makers with regards to the importance of aquatic animals' health, given the challenges they're faced with climate change, AMR, and we see that this demand is aligned with the strategic orientations that were presented by our General Director during the first day of our session.
Ecuador.
Gracias, señora presidenta.
Thank you, Mrs. Chair. Thanks, Alicia, for your presentation. I'd like to take a couple of minutes on behalf of Ecuador to thank our General Director, Dr. Souberan, and I'd like to thank you, Mrs. President, Dr. Pombo, for attending the regional conference in Ecuador. It was a pleasure for us to host this regional conference for the first time. And this conference was historic because we, as vet services, managed to have contacts with the aquaculture department, because this is a private industry. They are a very important contributor to our economy. But as Alicia did with her fish today, well, guess what? I have a fish that WOAH gave us. If you have a fish, show it. And next year, it would be great if we had a shrimp, by the way. So we all agree on working on AI HNV with an ad hoc group, because for us it's very important. And I'd like to say that within the technical forum we talked about vaccines and vaccines in aquaculture, and we believe that we need to analyze and see whether vaccines are efficient in shrimps or other crustaceans, because their immune system does not allow them to generate a response. And in countries like Chile or Ecuador or other Latin American countries, there is a group of experts, and I said, well, you are a group of fish, you're all together. So we need WOAH to have a positive impact on fish and crustacean farms everywhere in the world.
Director General. And now give the floor to Chile.
Gracias, señora presidenta. Chile quiere...
Thank you, Mrs. President. Chile would like to pay tribute to the work conducted by the Commission working on aquatic animals under the leadership of Alicia. She helped designing new standards which are a significant progress for fair and safe trade. And it's important to talk about aquatic species given the development of aquaculture over the last few years. And they contribute to food safety, and Chile will continue supporting the work of the Commission and the work of the ad hoc groups, and we're available to provide you with any contribution or information. And for Chile, this topic is very important because at the moment we are the second largest country producing salmon with $700 million in exports, and we also produce Metiligus and other species. This is very important from a job perspective, and aquaculture contributes to the livelihood of many families. So we need also to take into account the good control of the environment in order to continue moving forward. And another thing which is important is to see the development of aquaculture everywhere in the world. So, dear delegates, Mrs. President, Mrs. Secretary General, we suggest we should give more room to aquatic species within this organization. And Chile, just like Peru, is available. Our experts in animal health and welfare are available to support you. When we share experience and good practices, we encourage expertise, and we can then obtain standards that allow to have safe and fair trade, and it also allows reducing the risk.
The Assembly, China. Please go ahead.
Thank you very much. China congratulates the WOAH Aquatic Animal Health Standards Commission for achieving the main objective of the Chile Global Aquatic Animal Health Conference held in Chile during the 5 years past. The Commission has developed new chapters for biosecurity in aquaculture establishment, disease prevention and control, and trade measures, importation, exportation, procures, and health certificate. The Commission has re-evaluated and adjusted the period of biosecurity conditions and targeted surveillance for different passes of free country zone compartment in disease-specific chapters. A unified evaluation has been conducted on the susceptible species of disease listed in the directory, making them more scientific and feasible. The above standards will assist WOAH members in implementing disease prevention and control strategies and be helpful to protect and promote international trade of aquatic animals and their products. China proposes 2 suggestions. The first one is aquatic animal diseases often play a key role in determining the success or failure of large-scale breeding cages, large-scale breeding factory ship, and land-based breeding facilities being developed in many countries. And aquatic animal diseases pose a significant threat to wild population in nation ecosystems. While current focus is only on diseases listed in the code, which is not enough. Some diseases are not included in the WOAH list due to their widespread distribution. However, these diseases pose a huge threat and are difficult to prevent and control. For example, NNV, EHP, fish lice, and cryptocarian irritants. I hope WOAH can also provide diagnostic and prevention guidelines for these diseases, help members improve biosecurity and enhance their ability to prevent and control these diseases. The second suggestion is WOAH has excellent reference laboratory and collaborative centers network, providing strong scientific support for WOAH, but limited support for its members. I hope WOAH can establish a communication and exchange platform between the reference laboratory and collaboration center and its members. Further, leave a region the scientific support role of the reference laboratory and collaboration centers. Thank you very much.
Thank you so much. Are there any other comments? I have a request here from our Director General. Go ahead, please.
Yes, thank you very much. First, I want to congratulate Alicia and all the Commission for the huge work that has been done. We have seen it today. Then I would like to thank also Norway, Peru, Ecuador, Chile, China for their advocacy for the aquaculture, aquacul sector, or aquatic sector. I think indeed, and I thank Peru for reminding us that we need to work on a new strategy, because the actual strategy will end in 2025, yes, and this year, so we need indeed to renew our strategy. And I think that thanks Ecuador, of course, for this incredible regional conference. And I think indeed, and I want to do it, I think we will need to do it in the 8th strategic plan to really work on the relationship between reference lab, collaborating centers and members, and of course including aquatic reference centers. So indeed we need to continue to work on this very important sector, and we saw that it is a sector that is growing very fast. Thank you very much.
Yes, please go ahead, with pleasure. You have the floor.
Sí. Quiero dar las gracias a todos sus comentarios.
I want to thank you for your very kind comments. I want to thank our director for offering fish to everyone. And I want to thank all the members of the Secretariat for their huge and very accurate work, and always with a smile. So thank you. Thank you to my colleagues. Thank you to our Vice President, who also worked, took the lead on many of the chapters. I want to thank Soraya, and thank you all for your support. Thank you.
Congratulate you. It's really challenging for all of us, but thank you all for your commitment, because I guess that we can conclude that, yes, we still have space for aquatic and that we are really engaged with this sector. So before, and over to Montse, I really would like to say that challenges are not only in the aquatic world. I am facing a challenge here for keeping you in this room, for having quorum. And I really would like to remind you that we still have to have the quorum with 93 persons, 93 delegates here in the room. That's exactly the number that we have right now. And I need you to be here tomorrow for the entire day to have a productive day with the to approve the resolutions and standards. So wish you wish you a great conclusion of the day after assisting the session that Montse will now present to you. Go ahead, Montse.
Sí, sí, muchas gracias. Japan.
Thank you, Madam Chair. Yes, Japan would like to comment the very enthusiastic and energetic discussion about the fish. And actually, while listening this very active discussion about the fish, I'm really starving to eat the fish. And well, having said that, I have a very small, humble proposal that we have a choice to keep the discussion as it is now. Now means after the planned schedule has already been elapsed. Or otherwise, we are going to have a very energetic discussion about the technical session tomorrow morning, just before the scheduled discussion on the biological standards commission session. It's up to you, and I have no particular preference, but just a small suggestion. Thank you.
Thank you, Dr. Massa. I really appreciate. But I know you're all very tired, but I think because we didn't really receive a lot, well, we received one comment to the resolution. So I would suggest just for me to present you the draft resolution. There was a very big effort from the drafting, for the drafting group. We had 13 countries supporting the drafting and 3 organizations with whom we have agreement. So overall, it was quite quick. I think we came to a very nice proposal of a draft resolution number 29 in regards to the Animal Health Forum and particularly the technical item. So I would just like to post it in the if possible, in the screen, and I would like to take the comments from the floor. The draft resolution was uploaded to the website yesterday night as a working document, and the idea is for you to be aware that it's already there. If there are any particular comments that you want to respond to, we would be happy, because the idea is that tomorrow we will be presenting this resolution number 29 for adoption tomorrow. Overall, the resolution covers 10 considering that were drafted according to how the technical item was addressing the different issues, and then the recommendation, the resolution, that are 11 points that took into account same thing. They were responding to the considering, and overall they are covering the different recommendations that were gathered over the 2 days of the Animal Health Forum. So with that, I would like to open the floor for comments. If I see any comments. Ireland, the US, Ireland.
Thank you. Ireland would like to thank WOAH for this important draft resolution, given the importance of vaccination, and would just suggest a slight nuancing of bullet point 3 under considering that to reflect that appropriate vaccines may not always be available, and that in certain circumstances they may not be the most cost-effective option. So the suggested nuancing is vaccines, where available, can be one of the most cost-effective and impactful tools for the prevention, control, elimination and eradication of animal diseases with demonstrated contributions to animal health, animal welfare, public health, biodiversity, preservation and sustainable food systems within the One Health framework. So it's just at the start. Thanks.
Thank you. Well, if you can please share the specific comment to the drafting team, and I think it's, it's according to what we have discussed, so I think it could be included in the resolution. I have the US.
Thank you very much. Similarly, our comment is actually on recommendation number 3, and I'm looking for the opportunity to add a little flexibility there, where it currently reads, WOAH works to develop TPPs. We would suggest that WOAH will consider the development of TPPs, because that might require some flexibility. And then further in that same recommendation, add language after including those where vaccination could reduce the need for to replace the word replace the use of antimicrobials. So sorry I didn't make that very clear, but I will definitely provide it in writing.
Thank you. Actually, that was discussed during the drafting. So yes, we try to make the effort to add this flexibility as you're mentioning. So we're happy to consider the text and modify the recommendation number 3. I cannot see the name of the country. Brazil.
Obrigado, Presidente. Gracias, Montserrat.
Thank you, Mrs. President. We also took part in the exercise and we worked on this recommendation, but then we assessed the situation and there are a few points that need to be taken into consideration. So when we look at bullet point number 6 and number 8 and the suggestions laid out by members of CVP are as follows. We need to think about the additional impacts of prevention measures beyond vaccination. For instance, in Article 6, we suggest adding to the text veterinary vaccines along with other prevention measures that can reduce the significant outbreaks of the disease, etc. I'll share that in writing. And then for Article 8, likewise, because we don't want to forget that WOAH works on vaccination and has been working on vaccination for several years. We started with a very ambitious vaccination plan when we faced an FMD outbreak in a region with a high concentration of animals. So we had 400 million doses of vaccines per year. And this to remind you that there are standards and that there are things which are planned. And not recently. I mean, there are things that have been done in the past. So we would encourage WOAH in this Article 8. No, we would like to remind the fact that WOAH has done a lot. That WOAH has done a lot already and needs to continue working to improve animal health. But we are fully aware of these questions and have been for a long time.
So I fully understood that's the comment that relates to the comments you already submitted in writing.
Gracias.
Ecuador. Thank you, Montse. So recommendation number 4, as it was previously described, well, it evaluates the inclusion of vaccination for aquatic animals and as well as shrimps and prawns must have a specific condition because we do not necessarily recommend vaccination for prawns and shrimps. Belgium.
Thank you, Ms. Chair. I don't have a precise proposal. First of all, I would like to thank all the people who have assisted to create this proposal for resolution. I would suggest in recommendation 2, on which we talk about the development and update of international standards, to adjust it as well with the role of vaccination in the acquisition and keeping of disease-free status. If I will send a written comment on this, but it's the idea that it can play a role also in these statuses.
Thank you for that. It's relevant. We will also try to propose a wording on that. I don't see any other comments. Australia.
Thank you for the opportunity to comment. Australia would also congratulate the drafting team for developing the resolution. We have 2 further suggestions that relate to recommendation 2 and recommendation 8, just to simplify some of the language. For recommendation 2, we found the first and the second sentence has some duplication in it, and would suggest that the second sentence is changed to read, WOAH members strive to implement these standards within their own context, recognising the value vaccines can contribute to animal health and welfare, and removing the additional text. And for recommendation 8, we suggest that WOAH and its members advocate. I think that it is on all of us within our own situations, not just WOAH, to advocate for the adoption of control strategies that are contextual. And in addition, we would also recommend that the comment or the provision around regional guidance is adjusted so that it is a standalone statement that says within recommendation 8, this guidance is tailored for the relevant region, including the need for capacity building and tailored communication strategies. But we will submit those comments in writing to the Secretariat. Thank you.
Thank you, Australia, for those comments. They were also more or less discussed during the drafting, so we certainly can consider them. I don't see any other comments. So I really appreciate everyone for the great investment on this particular technical item. And in particular, I want to thank the two rapporteurs for doing an excellent job, Bati and Merichel. We really, really appreciate all the investment and the proactiveness and the work, as well as the Secretariat, in particular to Andres, to Rachel, that they were behind the scenes, nobody could really see them. And my two heads of department, the stars of the show, because they really coordinated and they are a proof of the transversal work of WOAH. So Javier and Gregorio, thank you very much for that. So with that, I will propose, we will try to make the comments tonight and redraft the resolution so that you can have it on, you can consult it tomorrow morning. So that when it's presented for adoption, you are aware of these changes. And with that, I will liberate you. I hope that we can finally, I really appreciate your patience and the interest that you put all through the day. The respect to both the work of the three commissions that they've done also an amazing job over the year. So thank you so much, and I leave the floor for the President.
Thank you so much. I really want to thank you, Monse, for your leadership in this, and of course all the team, all the people that were involved in this working group for the drafting. Remember that this will be submitted tomorrow for your approval, so be here, rested well, and enjoy Paris. Thank you so much. Good morning, dear colleagues, dear delegates. I really want your help to fill the room because we are waiting for quorum. We only have 60 delegates in the room and we need 93. Thank you.